sure that we care for the patient, it makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matres. Siyempre po, natatakot po ako na ayun nga po, baka may cancer nga po. Sinabi nga po ng mga specialista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na lang ako magpa-work up.
Magkapit-bahay po kami, tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses, mga admin po. Ina-address po nila yung infection control, medication safety, patient safety, procedure safety, and proper communication po, and teamwork collaboration. Number one na importante sa infection health control or infection control would be hand hygiene, yung proper hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, chinecheck din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness nila, yung mga patulog-tulog. Sa safety procedures po ng laboratories or extraction ng blood, importante number one, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanino lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga consultant, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang may papangako lang po sana at ang pinaka-importanting magagawa namin as nurses is yung ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, ano po, okay po, satisfied naman po sa kanila. Kampante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Ministerial ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety.
It is a great honor to welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
This partnership will harness the strengths of both countries to improve health outcomes and foster international cooperation through joint efforts in health.
Together, let us strengthen the weave of patient safety, thread by thread, policy by policy, life by life. Because in the Philippines we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat, and once again, mabuhay. Welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
Sa lahat ng Luzon, Visayas at Mindanao, ng mga ospital ng Department of Health, itinataguyod namin ang pagbalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the patient, watchers, and the other healthcare providers. Ini-ensure namin na walang medical error na mangyari. Importante na ma-orient ang ating mga pasyente about sa kanilang mga treatment plans.
Since yung tatay ko po is a cancer patient and status po is stroke, mapa-anesthesiologist, sa IM, sa surgery na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa. Hindi lang po dito nagtatapos dito sa hospital ang pakikuugnayan ng mga healthcare worker dito sa hospitals kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi syempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks inalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffy Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, lagi nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Binadetalye po nila yung gagawin po sa sakit namin. Nararamdaman po talaga namin na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols such as the patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta. Kahit hindi ko ano.
yung tiwala po namin sa kanila parang mas lumalim pa po.
To all our patients at Western Visayas Medical Center,
As you come in here, we would like to take care of you. We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
So the most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department, most of our patients has difficulty of sleep. Companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
We have the safety plan, we have a safety committee. Doon nakalpaloob na lahat ng components, the procedures that we need to take in order to maintain yung safety. Hindi lang sa patient, the single watchers, visitors, and even the staff itself.
The most important part of my job as healthcare professional is providing patient safety is to ensure a clear, accurate, timely communication ng healthcare professionals. A proper identification kung ano yung gamit na gagamitin, proper medication, proper dosage, no? And then proper identification and routing sa patient na pabibigyan natin.
Kung wala tayong proper communication, so it will hinder the care for our patients. This hospital see to it that almost all our employees will be sent for trainings for competency with the different specialties that we have in our institution.
Hindi mo ma-feel na parang iba ka sa kanila. Actually, nagbibigay talaga sila naglapas ng loob sa akin personally to fight.
Binabantayan ko po yung asawa ko na aksidente sa proyekto. Pag in-explain na ng mga nurses or doctors, alam namin na okay talaga yun para sa pasyente nila. Maganda talaga yung pag-aalaga nila. Kahit wala ako or nagbili lang ako sa mail, nandiyan po yung mga nurse ko.
Make sure that we care for the patient. It makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matres. Siyempre po, natatakot po ako na ayun nga po, baka may cancer nga po. Sinabi nga po ng mga specialista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na lang ako magpa-work up.
Magkapit-bahay po kami, tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses,
Good morning, everyone.
mga admin po.
We will start the
Ina-address po
program
nila yung
at
infection
9:10
control,
in the morning.
medication safety,
Again,
patient safety, procedure safety and proper
Good morning,
communication po
everyone.
and teamwork
We'll start our
collaboration.
program for the date of the
Number
7th
one,
Global
ang
Ministerial
importante sa
Summit for
infection
Patient
health
Safety
control or
at
infection
exactly
control would be
9:10 in the morning.
proper
Thank you.
hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, chinecheck din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness sila, yung mga patulog-tulog. Sa safety procedures po ng laboratories or extraction ng blood, importante number 1, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanina lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga consultant, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang may papangako lang po sana at ang pinaka-importanting magagawa namin as nurses is yung ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, okay po, satisfied naman po sa kanila. Ang pante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Ministerial ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety. It is a great honor to welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we
Good morning to all esteemed ministers, distinguished delegates, experts, and honored guests. A pleasant morning to all of you. It is my great pleasure to welcome you all on our day 2 of the 7th Global Ministerial Summit for Patient Safety. Once again, I am Diane Keller. I'll be your host for today. Well, yesterday, indeed, there were meaningful discussions, invaluable insights, and collectively advance the commitment to the safety of patients across the globe. There were discussions on challenges, best practices, and it was made clear that patient safety is indeed a priority for governments, organizations, and healthcare systems worldwide. Speaking of worldwide, we are live on the official social media pages of the Department of Health on Facebook and YouTube. So we'd like to say hello to all the residents joining us online in this momentous occasion. And now, ladies and gentlemen, we continue with this important journey, building on the momentum that has been gained, with even more engaging sessions and impactful conversations. And now, to start off, we welcome on stage Mr. Mark Pearson, Deputy Director of the Directorate for Employment, Labor and Social Affairs, Organization for Economic Cooperation and Development, for the plenary lecture on the economics of diagnostic safety. Good morning, sir.
Well, good morning, everybody. Huge pleasure, huge honor to be here today. And let me start by thank you very much, by thanking our hosts for entertaining us so well last night, and indeed for organizing the entire event so very, very efficiently. I know it's no easy task to organize an event on this scale, and you've done it wonderfully well. Now, I think yesterday we heard lots of examples of people giving their personal stories about failings in patient safety. And let me give you my story. It's nowhere near as exciting or tragic as many of those that we heard yesterday. Indeed, in many respects, it's quite trivial. I was once traveling somewhere and I got bitten by a venomous snake, which it turned out had really quite poor dental hygiene and gave me an infection related to rat urine. And I was really quite sick. I made it back to Paris, where I live, and it was initially diagnosed absolutely correctly as being something to do with a snake bite. My work then panicked and said, oh no, you can't rely on your local hospital for this. Go and see a tropical medicine specialist, which I duly did, who then misdiagnosed me and decided it was actually just a really, really bad case of gout, of all things. Now, it took about 48 hours for them to finally revert to the original diagnosis of it being a snake bite and the rat urine infection. It meant that I spent 5 days in hospital. And I say, that's a trivial example. Trivial because, okay, I had 5 days out of action. Most of the time I was on morphine, so in fact didn't care that much. I've clearly recovered. I'm perfectly fine. But the reason why I'm mentioning that is that that error made by that slightly arrogant second doctor I saw meant that I had to spend 5 days in hospital. The cost of that was somewhere between $5,000 and $10,000 US. Obviously, the reason why we care about patient safety is mainly because of the patients they suffer. But what we mustn't forget is that there is also a massive direct cost, economic cost to these errors. And when our health systems are all under such pressure, such enormous pressure financially, spending $5,000 to $10,000 for making a small misdiagnosis of a minor case, multiplied by all the errors that we get in diagnosis, adds up to a huge amount of money and potential savings that we could use within the health system. And that's what I'm going to talk about today. I'm going to talk about the economics of patient safety. Not that I think the economics is the most important thing, but it is an important thing that we should be taking into account. And this report that we've done on the economics of patient safety is in fact the 7th report that we've done on the economics of patient safety. This particular one focusing on diagnostic errors, diagnostic safety, was funded, as were all the previous 6, by the Federal Ministry of Health in Germany, for whom I would like to give many, many thanks. I know some of them are here today. You have been leaders in this area for so long. We really rely on your continued leadership in pushing forward the patient safety agenda. I do know that not all of you, I'm going to be very quick on this slide, not all of you will know the OECD. We are an international organization really working mainly with high income and high middle income countries, 38 countries. In this region, we have Japan and Korea, Australia and New Zealand as members. There's Indonesia and Thailand are in the process of joining. And we work on the economics of health. And economic analyses of health system performance, international discussions on health policy. Right, let me get back to patient safety. You've heard this already, those of you who were here yesterday. But unsafe care causes 3 million deaths globally each year. There's nothing natural or inevitable about this. We can do much better. Unsafe care consumes healthcare resources, 6% of total hospital bed days and more than 7 million hospital admissions across the 38 OECD countries. And in terms of the economic costs, the direct costs amount to about 13% of health spending across the OECD. That's, if you like, some of the bottom line numbers. I'll go into more detail, and that 13%, you're going to forget about that because I'm going to give a slightly larger number later on once we've added in all the other aspects to do with diagnostic safety. But let me just say a little bit more about the total economics, not just on diagnostic safety, but on patient safety altogether, drawing on the other 6 reports that we've done on the economics of patient safety, looking at different aspects, looking at hospital safety, primary care, ambulatory care safety, long-term care, as well as health workforce, medication, and patient engagement. So, for example, our report on patient safety in hospitals show that on average, 1 in 10 hospitalizations results in a safety failure. And that's approximately 15% of hospital expenditure and activity in OECD countries is due to safety failures. Our report on primary care showed that about 50% of total patient harm burden originates in primary and ambulatory care, and that safety lapses in primary care account for about 7 million hospital admissions each year in the OECD. Our report on long-term care safety showed that over half of all the harm that occurs in long-term care is preventable, and that the costs of annual avoidable admissions to hospitals from long-term care facilities is equivalent to about 4.5% of total hospital care expenditure. So on top of all those studies, what we've done in our most recent report is to look at diagnostic safety as a cross-cutting issue across all the different healthcare institutions, the economics of diagnostic safety. The framework that we use, I think you're probably all familiar with this framework, the diagnostic framework. Diagnosis needs to be timely, accurate, and communicated to the patient. And that indeed is the definition that we use in the report. The diagnostic error is failure to accurately and timely identify the underlying health condition or to communicate this to the patient. It is, as we all know, an iterative and complex process. Delays and errors are obviously possible and can lead to unintended and harmful consequences. And these failures incur substantial costs across healthcare settings. So let me get on to our results. I suppose this is the top level messages, some of the top level messages from our report. We're estimating the burden of diagnostic error in terms of misdiagnosis, overdiagnosis, underdiagnosis, and of course the timing. So depending on the healthcare setting, we're looking at, first of all, at misdiagnoses. about 10 to 15% of all the diagnoses done in a healthcare setting involve a diagnostic error. You know, the sorts of areas where you get particular problems, mental health, we know that 1 in 9 adults are misdiagnosed in the UK with their mental health issues. Cancer screening is another one that we heard a lot about, I think yesterday, due to lack of integrated information systems. There often results in error rates. There's an 11% error rate in cancer screening in the United States. A systemic review of autopsy studies found a 28% misdiagnosis rate. Misdiagnosis is endemic in our health systems. But it's also overdiagnosis. Overdiagnosis does lead to unnecessary overtreatment, patient anxiety, and healthcare costs. We've seen big problems, for example, in thyroid cancer in Korea in the past due to excessive screening. Breast cancer overdiagnosis costs about $4 billion in the United States. Not just a rich country problem, overdiagnosis of malaria costs $90 million per year in the Sudan. Moving on to underdiagnosis, we're going to say less about underdiagnosis, but underdiagnosis for some diseases adds up to very large economic costs. ADHD underdiagnosis in the United States has been estimated to cost $190 billion per year, mainly due to the impact through the labour market. Timing, delayed diagnosis of appendicitis, costs $21 billion per year in the United States. And adding all these things together, what we're finding is diagnostic error is the single largest cause of serious harm from safety failures in our health systems. So what we've done in the report is to add up all these various pieces to estimate the total direct costs of diagnostic error. And this is just a slightly boring chart, but do need to put it just so you know what we did. We've taken all the disease-specific and country-specific work that's been done and bring it together in some sort of systematic way so we can start adding up the different costs from the different diseases, make assumptions about what's happening in the rest of the health system where we don't have direct evidence, in order to calculate the direct costs of diagnostic care. Now that, for misdiagnosis and for overdiagnosis, we can do in a relatively straightforward way. We've included also the direct costs for underdiagnosis. That's much harder to do, I will acknowledge, and we've got quite a conservative estimate here in the numbers when we add everything up. But we add all of these things up across primary, long-term care and inpatient care settings. And just to emphasize, these are the direct costs, by which I mean we're not adding in the labour market costs. So the fact that sick people, due to unsafe care, are not at work, we're not including those estimates in the total figures I'm about to talk about. Just the direct costs on the health system. You add them all up, and the answer is direct costs add up to at least 17.5% of healthcare expenditure. So 17.5% of the money that we spend on our health systems is simply due to diagnostic errors. The costs are found across all parts of the health system, long-term care, primary care, inpatient. It's equivalent to about $870 billion of healthcare expenditure. And remember, these are conservative estimates. We have been quite careful in not trying to push the numbers too far. Real figures are probably even higher than the numbers that we've included in this report. Just talking about the costs isn't good enough. We do need to talk about whether we know that there are cost-effective or even just effective ways to reduce diagnostics errors and to address diagnostic safety. And we do think that there is sufficient evidence out there of what works in different areas to be able to say that we do know what we can do. It's not just a set of one-off studies. There is something that we can say systematically about what works in improving diagnostic safety. And there's a long list of different areas where we think progress needs to be made. Diagnostics in clinical practice, so improving clinical skills, rationalization of diagnostic tests and so on. I think what you'll find in the report, we've also found examples of countries where they've made progress in these different areas. So for example, I mentioned overdiagnosis of thyroid cancer earlier in Korea. They have effectively addressed it. They set up a coalition which updated national guidelines, reduced overdiagnosis by about 50%. Yesterday we heard quite a lot about sepsis care. And again, I think we've seen sepsis care bundles being introduced in different countries to standardize diagnosis and treatment with great effect. The second broad area, the communication of diagnosis, teamwork, multidisciplinary discussions, you know, the sorts of things. I think just recently we did something at the OECD called the Paris Survey, and I think we can see that, that actually those practices, primary care practices, that electronically exchange lab and diagnostic results with people outside the practice end up with better outcomes than those that are unable to do this. The third line there, monitoring and reporting, is obviously leveraging different digital tools and AI to improve diagnostic accuracy and performance and reporting. You know, I think, again, examples that we've come across in this area, the Choosing Wisely, fantastic initiative. The one in Canada achieved a 90% reduction in unnecessary lab testing through an electronic alert system. And of course, new tech means new opportunities. We heard, I think, about the fascinating sepsis instruments by Johns Hopkins yesterday, but I think in the UK there's the Find AF algorithm is used to scan GP medical records to look for red flags for atrial fibrillation. I think, you know, we can come up with lots of examples in all these different areas of where countries have actually made a difference to actually their patient safety outcomes in a cost-effective way. Doesn't happen, however, just by chance. It's not the case. Often in health systems, we respond to issues by setting up a new body, saying it's in charge of patient safety or quality or whatever, and thinking somehow that's enough. That's what we do as a policy. It's never enough. This is not something which is solved by a simple institutional change. It is, as we all know, because we're here at this summit, something that needs a coalition across all the different stakeholders in the healthcare sector to push for meaningful change to promote patient safety. Clinicians and medical associations, medical educators and patients, health insurers and hospital managers, and of course the national patient safety offices or agencies. We need all of those to be acting in the same direction in order to be able to push down diagnostic error across the health system. I've talked about the total costs of diagnostic safety, of errors, of miss, over and under diagnosis in our health systems. We're never going to prevent all errors. I mean, let's be realistic. We do, however, based on our estimates of what's worked in different countries, think that we can come up with a package of what could be done, what is feasible over the medium term in order to reduce miss over and under diagnostic errors. So our plausible scenario is to say, let's imagine that we could invest about 0.8% of what we currently spend on health in promoting diagnostic safety improvements. So 0.8%, less than 1% of what we currently spend on health. If we reinvested that in various of the patient safety measures that we know work, we think it's plausible that we could eventually aim to reduce diagnostic errors by about 50%. That would save us 8% of healthcare spending. So we redirect 0.8% and we save 8% of healthcare spending. About 390 billion US dollars of health expenditure per year. That's just the economic benefits. I repeat, I'm an economist. We tend to reduce everything to numbers. That's why everybody hates us. Even our mothers hate economists. We know. I mean, we're very annoying in talking about dollars all the time. The real benefits are not just in the numbers. The real benefits are, of course, that we are saving people from unnecessary harm. That's why we want to do all this. The case I just want to talk about, I've been trying to persuade you of today, it's not, that's why you do it. You want to save patients. But the economic case for redirecting funds towards reducing errors in diagnostic safety is overwhelming. There is an economic return to doing this. And that's my role as an economist. So let me just very quickly sum up. Oops. We've tried to pull together all the evidence across the OECD countries to estimate the burden and direct costs of diagnostic error. And we believe they add up to about 17.5% of total healthcare expenditure. That's wasteful and harmful healthcare as a result of spending this 17.5% of our budgets. We think that's a huge amount, an amount that we desperately need in order to make sure our health systems can cope with the challenges they're currently facing. When ministries of finance come asking for their money back because we're spending too much on health, we know what happens. Essential services are cut, out-of-pocket payments go up, our hard-working, highly skilled health professionals are told to accept lower pay and worse conditions. There is an alternative. The alternative is to persuade our ministries of health to let us divert a little bit of that spending in order to be able to make real savings by reducing the amount of errors that we make in our health system. Because we believe that by spending a small amount of money relative to total spending on reducing diagnostic error, we could cut the amount of diagnostic errors by half. Right, there you go. That's my speech for this morning. I really, really look forward to the rest of the discussions today and to hear about all the things that the countries are doing to promote diagnostic safety. This is a fantastic initiative. I think I've attended about 4 of these patient safety summits over the years. I think they're really great initiatives that make a real difference in pulling all the different stakeholders together to promote better patient safety, to give it more prominence, the prominence it deserves in our discussions of healthcare. So I really, really do congratulate you for all making the effort, for having come here, and really look forward to the rest of your discussions. Thank you very much.
Thank you very much, Mr. Mark Pearson. Now moving on, we now go to a deeply important segment of our program where we will hear directly from those at the heart of our discussions, patients and caregivers with lived experiences on patient safety. This session, titled Safe and Respectful Care, Testimonies and Expectations of Patients or Caregivers with Lived Experiences on Patient Safety Incidents, will offer invaluable insights into the real-world impact of patient safety. We are honored to have 2 powerful advocates with us today. First, please join me in welcoming Ms. Cara Magsanok Alikpala, co-founder of the Philippine Alliance for Patient Organization, Vice President of Cancer Coalition Philippines, and founding president of the I Can Serve Foundation. And second, we will hear later from Dr. Katharina Kovacs-Burns, Board Chair of Patients for Patient Safety Canada, PFPS. Ms. Magsanok Alikpala and Dr. Kovacs-Burns, thank you indeed for your willingness to share your experiences and perspectives. First up, let's hear it from Ms. Cara Magsanok Alikpala. Let's give her a big round of applause, please.
Good morning, everyone. Is it a good morning for everyone? Are you ready for some storytelling? Make it a little louder. We're not going to have bedtime stories nor fairy tales, unfortunately, but true stories. Are you ready to take a break from charts, figures, and all these numbers and data? I hope so. So good morning again to all the health ministers. Thank you for coming to our country. Good morning to friends from ADB, from the World Health Organization, and the hardworking team of the Department of Health. A special shout out to patients in the room. Actually, most of us become patients, especially to Sue Sheridan and Charlotte Cute. Thanks for your wonderful insights yesterday. And to my friends at the Philippine Alliance of Patient Organizations. Good morning to all of you. I got into patient advocacy because I was misdiagnosed twice. I had a growing lump on my breast, and the first doctor I saw said there was nothing wrong with me. The second doctor said I was too young at 30 to have breast cancer. My father, who always wanted to cover all bases, insisted on a mammogram, even though if I was too young to have a mammogram. The radiologist said the mammogram didn't look good and suggested a biopsy. But my second doctor confidently said there was no need for one. My father insisted again on a biopsy, promising him a tennis racket if he won the bet. My dad won the bet, and I was diagnosed with breast cancer stage 2A. Immediately after my lumpectomy, I did not receive pain management at the hospital, and so I was constantly in pain. I brought it up, but the nurses didn't address it. I thought this was standard care, only to find out later on that it was not. My dad started to lose hope in the system. So we went to Stanford University in the USA for a second opinion and discovered a different world in healthcare. We experienced the meaning of patient power, a partnership relationship between doctor and patient, and the collaborative nature of multidisciplinary. This was in 1997, so healthcare was so much different in the Philippines back then. But there was more bad news. I needed chemotherapy and would never have children because of the protocol. I had just gotten engaged, and finding out I couldn't have children was more devastating than finding out I had cancer. I still had to try and carry on, which I did. And along with 3 other breast cancer survivors, we formed the organization I Can Serve Foundation. At first, we only focused on high-impact information campaigns. We met a woman who was diagnosed with breast cancer, had a mastectomy, and did chemotherapy. Months later, she discovered she was misdiagnosed. She had lung cancer, not breast cancer. And this is not mets to lungs from breast, it was just lung cancer. She lost so much time getting treated for the wrong cancer. Sadly, she died shortly after this happened. Her story and many other horror stories we started to hear, plus gaps in the care, were some of the triggers that made us at the I Can Serve Foundation intensify our work in the community level. We created our flagship program called Ating Dibdibin, or Take Your Breast Care to Heart, where we institutionalize community breast care, cancer control programs in cities. Despite being a patient advocate, I sometimes feel like a failure. My late mother-in-law had metastatic colorectal cancer and was a dialysis patient. When she was confined at the hospital for what we suspected was going to be her last, in 2022, we wanted to surround her with her love language, which was food, music, and prayer. We wanted her last days to be peaceful and painless, but it was anything but. She had difficulty breathing and needed a BiPAP machine. She never got one till 14 hours later. The hospital didn't give her pain meds on time. It was never clear to us if they forgot, or if the drugs were out of stock, or if there weren't enough nurses to administer the medicine. Heart-crushing, to say the least, to see a loved one suffer. I and my in-laws complained all the time to the nurses' station, all the way to the big boss of the hospital, who happens to be a family friend. Things improved a little bit, but too little, too late. The last few years for Armando Lanorio was also not easy. He was the brother of a patient advocate, Ara Lanorio of the Philippine Alliance of Patient Organizations. Armando was a policeman who was part of the Philippine contingent that formed part of the peacekeeping force in Afghanistan. He was diagnosed with leukemia 2 months after his 50th birthday. He was on chemotherapy when he experienced a swelling of his big toe. He saw an orthopedic doctor who prescribed antibiotics for what doctors thought was an infection. But the swelling didn't improve, and the doctor said, "Time to cut the toe." Ara, the patient's sister, and my friend, the advocate, from the get-go, remember what the oncologist of her brother said. Your brother cannot afford an open wound, and surgery is a no-no. So Ara consulted an internist who ran some tests, and it turned out he didn't have an infected toe. Armando had high levels of uric acid, and his was a bad case of gout. Ara wanted to complain, file a formal complaint, but Armando stopped her, saying the medical team might get back at him. This is common for patients who fear reporting errors of the medical team for fear of retaliation. Also, for a lot of people in Asia, I'm sure the Asians can relate, it's not in our nature to be very confrontational. We are very personalistic, even in the most professional situations. When someone is brutally frank, we take offense on a very deep personal level. That's why so many incidences go unreported. Another no-no happened to a 19-year-old, that's Ara with the brother and another sister, Arlene. Another no-no happened to a 19-year-old hemophilia patient. He went to the hospital for abdominal pain, and one of the big no-nos for hemophilia patients is intramuscular injections. It's risky and can cause hemorrhage. But this is exactly what one doctor did. He gave the patient an analgesic via the intramuscular route to treat the abdominal pain. The patient's arm swelled and grew bigger than his thigh. It has caused much discomfort for the patient till today, as we speak. When the patient's parents complained to the doctor, his smug response was, "Oh yeah, I hit a muscle." No apology. I never really show pictures like this, but the family insisted that I share this photo with them to just give a punch to their story and drive home a point. I mistakenly thought for a while that incidents like these only happen outside major Philippine cities where there are less healthcare providers and facilities. A friend vacationed in one of the top tourist beach destinations in the country. My friend, who didn't agree to share her name, she developed appendicitis and needed an appendectomy, which she got in a very small local hospital in the resort town. Appendectomy seems so usual now, right? When she was discharged, she returned to Manila, and she was in great pain and had pus all over the area of the incision and swelling in her abdomen. Her abdominal lining was infected. She was confined in the hospital to treat her infection. She also needed another surgery. The medical team said the operating room at the resort town was not sterile enough and contaminated equipment may have been used. A co-patient advocate's bad experience yielded a better outcome because of her persistence. Her name is Mel Lamasin, and her cousin is Hannah, the one in the photo, Hannah Azul. She went to a public hospital to get treated for tonsillitis, very simple. She works in a call center. She was confined for a few days and given antibiotics. Upon checkout, Mel, my friend, the patient advocate, spotted something incorrect on the PhilHealth claim form. PhilHealth stands for Philippine Healthcare System. That's our country's state health insurance. And the form usually indicates how much the state insurance can cover. And the diagnosis of Hannah on that form said end-stage renal disease instead of tonsillitis. So my friend Mel, you would want her to be your friend, confronted the doctor who wrote the wrong diagnosis. And the doctor responded, "Don't you prefer this diagnosis? You will receive a bigger deduction from PhilHealth because it's more serious than tonsillitis." They were outraged by this suggestion. The doctor eventually admitted she didn't read the patient charts correctly and mistook her for another patient. Mel went straight to the executive committee to report this. She didn't go to any subordinate. The hospital responded, thanked her for the complaint, and from that time, the hospital made it mandatory for the PhilHealth claim form to be attached to the patient's chart to avoid confusion. Thank you, Mel, for that. I also think women cope better as patients. Don't you think so? They have girlfriends as support group the way Mel and Hannah are girlfriends. I also think that's a secret to a happy marriage. Girlfriends. Only for the wives. On the other hand, male patients don't share their feelings and fear. A friend of mine, Emma Ross, an engineer, an entrepreneur, and host of a business radio program, was diagnosed with laryngeal cancer at 43 years old. I think it was a lack of communication that happened to him. His doctor never told him what to expect. All that the doctor said was he would take out the tumor from his vocal cords. He and his family weren't warned that during surgery, all his vocal cords would be taken out and he would never be able to ever speak. He was never told he was going to have a hole in his neck forever. That was his new passageway for breathing, so the nose is now just a decoration. He was never told he would lose his sense of smell. It was a tough time for the family, emotionally and financially. The doctor said, "Oh, that's a price to pay for your life." But what kind of life? Emmer wasn't prepared for this new normal. Emmer got into depression and lost his zest for work and gave up on his business, and sadly, this ended his radio career. A few years later, his cancer recurred. He almost didn't complete chemotherapy because he didn't want to deal anymore. He got his groove back some 3 years later when he joined cancer advocacy groups till he established his own, the New Voice Association, and later Langhap, an alliance for lung cancer. He was actively involved in the lobby for the syntax reform law. He also became the executive director for the National Council on Disability Affairs. He uses an electrolarynx, a device that can produce a robotic voice. Today, Emmer has never spoken louder and prouder as he defends the rights of cancer patients. Thank you, Emmer. On the other hand, some men try to keep a very low profile, unlike Emmer, especially if they are frequent targets for discrimination, like Dom de los Santos. From the time he found out he had psoriasis in high school, he lost a lot of friends who would cringe at the sight of his red, scaly patches, silvery scales, thickened skin, black nails. He plunged into depression and stayed home for 3 years. Once he had a flare-up that wouldn't let up, so he went for a consult to an overcrowded public hospital. Before he could explain his condition, the doctor immediately told him, "Dom, you should take an HIV test." Many patients in the room overheard that conversation. Dom said he felt like the world collapsed on him. Why is HIV the first thing the doctor assumes? He just added to the list of stigma Dom has to deal with. On his way out, he caused many heads to turn. People gave him the look. He said all patients need safe spaces when meeting doctors. Dom is now an active patient advocate of Psoriasis Philippines and proudly more aware and assertive of his rights and that of his friends. And yes, he never had HIV. Some doctors are more thoughtful and admit and apologize for their mistakes. Richard Parzal, 50, another psoriasis patient, was given the wrong protocol. He was told to take his medicine every day, and he did as he was told. The day after he took it, the doctor surprisingly showed up in his house. The doctor said, "Oops, I made a mistake, I'm sorry. You should only take the drug once a week, not every day." He apologized and gave a corrected prescription. Had he continued with the incorrect protocol, Richard could have risked many complications, including death. A lot of stories I shared involve patient advocates, and sadly, they or their loved ones are not exempt from being casualties of patient safety issues. And mind you, most of the stories I'm telling you are not just happening in public hospitals, but private hospitals as well. But one of the most humiliating I heard was when a cancer patient advocate was confined at the ICU. She had cervical cancer, diabetes, hypertension, asthma, and pneumonia. The doctor warned if she were to be given a sponge bath, it had to be quick because her body can't be exposed to cold for a long time. Come bath time, the ICU nurse administered a sponge bath to my friend, but also administered a bath to another patient at the same time. The nurse used very cold water, and my friend would be left naked and shaking for long periods for the nurse to attend to another patient. My friend was too weak to complain. She just kept crying during the bath. It was disheartening for her because she always considered the hospital her home, where she volunteered for several years as a patient navigator for the poor. I have met many patients who were casualties of a weak safety culture without knowing they were. They are worse off because they are defenseless. I know this is the era of patient empowerment, but also not all patients have the capacity. We need a comprehensive, robust ecosystem to represent those who can't speak for themselves. We at the Philippine Alliance of Patient Organizations, or PAPO, work double time to be proactive and always provide patient leaders and patient groups with educational and capacity building platforms. We are planning to create a patient-driven hospital rating system with patient safety as one criteria. I guess we really want to create a more accessible feedback mechanism, something as easy as, say, shopping online or just booking a vacation on a travel app. 4 years after my chemotherapy, I defied my doctor's prediction and gave birth to a miracle child. I'm very grateful, and I suspect getting my life's dream of being a mother is the fuel that has kept me going in this advocacy for more than 27 years. Since then, I've stopped complaining and just tried to become part of the solution. But not everyone is lucky. Not everyone gets a miracle. Patient safety issues are not just, oops, I made a mistake, I'm sorry. The lack or absence of a patient safety culture means someone may be rendered disabled. Breadwinners won't be able to feed their families. Children might not be able to play, go to school. Families could plunge into generational debt and deprive their family of options, opportunities, and the chance to realize their dreams. Someone could slip into irreversible trauma or depression. Someone will turn to alternative, where practices are unethical, untested. Someone could die. Children could lose parents and never experience unconditional love again. People would unfriend hope. What's the world without hope? Whatever's the call to action today, please, please make it stick. Make us patients true and not token partners. Please make it happen immediately and make it look much better than it does on paper or on this wall. Thank you very much. Thank you for having me.
Thank you very much, Ms. Magsanok Alikpala, for sharing those testimonies and stories. And indeed, you provided a perspective on the impact of patient safety and what can still be done by various stakeholders in terms of patient safety. And now I believe we'll have a video message by Dr. Katharina Kovacs-Burns. Let's hear it from Dr. Burns.
Greetings to everyone at the 7th Global Ministerial Summit on Patient Safety. I am Kathy Kovacs-Burns, the volunteer chair for the Board of Directors for Patient Safety Canada. I am sorry that I can't be there with you in person today due to family urgent situations. But I hope that this video I'm sharing with you will have some context for some of the discussions you will carry on during the summit, and look forward to any follow-ups as well. So I am grateful to the organizers for providing me the opportunity to speak with you about a very important topic of safe and respectful care, and specifically looking at testimonials and the expectations of patients, caregivers, or those of us who have lived experiences with patient safety incidents. So Patient Safety Canada is a national, patient-led, not-for-profit organization. All of our members are mostly patients and families, but also healthcare providers. And all of us have been harmed by the healthcare system in some way or another. We have a lot of stories to share and experiences, and we do that in different ways, and we share them so that we can provide some different opportunities for learning and for making a difference. So why do we do this? Well, we do know that the rates of patient safety incidents and harm has been escalating over the years. And certainly during COVID, it really became quite profound. So in this particular slide, you can see that 1 in 17 hospital stays in Canada involved at least one harmful event. Well, that's one too many. And this keeps going up. Similar trends are probably seen in the community, primary care and long-term care facilities and care settings. So we have to do something about this. We know that when we talk about safe and respectful care, we also have to gather the experiences of those individuals who are receiving the care. So the patients, the caregivers, and those who are giving the care, healthcare providers as well. We don't leave them out. So when an incident happens, those testimonials from the patients, caregivers, families, and even healthcare providers become pretty critical. We want to hear those stories because that's how we learn to understand what those experiences are like, what harm those individuals have experienced. And part of that then leads to our expectations that we hope ultimately that our experience and our shared stories or narratives, testimonials, will make a difference in some way, and so that we can prevent similar kinds of incidents from happening again, and that nobody has to experience that kind of experience again. So let's start with testimonials. Well, we do know that patients are the experts of their journey and experience. It's a type of evidence. So when we talk about a testimonial or a narrative or a story, there are very different kinds of ways to tell a story. Some of them could be short videos, 4 minutes long. Some of them can be lengthy narratives or case studies. So it depends on the purpose of the testimonial and the audience. Who are we speaking to? Is it our peers? Is it healthcare providers? Is it leaders in healthcare? Decision makers, policy decision makers. So all of these things are very critical when we line up a testimonial and try to prepare something that will be of reasonable expectation in terms of what people hear and what we deliver and how it can actually be utilized. So what does one say? Well, there are different kinds of guides for the stories that we tell. Some of them are like the World Health Organization Storytelling Guide, or similar ones that the ministry has provided for me to share with you. We use similar kinds of things in Canada. So you should always start out with the personal experiences. I mean, why did somebody access healthcare in the first place? What was the situation? What was the patient safety incident? What went wrong? Were there any warning signs leading up to the incident? What was the consequences and impact? What was the harm that individuals felt, experienced emotionally, physically, and otherwise? Were there supports? What were the lessons learned? Was there anything in terms of advocacy that we could actually learn to prioritize? And how does that lead into a call for action for our ministers of health? What is it that they can carry forward as a message going forward? So there's different ways to gather that. The expectations, well, we know there's potential power in testimonials. They are far-reaching. They are have an impact. And especially if we have our aim of our testimonial starting out with, attention, please. I have a story to share. I want to capture the interest. I want to tell you about my experience and the harm that I experienced, that my family and caregivers experienced, and even those of healthcare providers. You want to reach people emotionally through the story, the voice, the language, and the emotions. You want them to never forget your story. You want them to remember it. And that comes from some of the what ifs as well, as we play on that. What if a different path had been taken? Would it have made a difference in the outcomes? And how do we influence those changes in practice, in policy? And that really is a call to action. It's also what we hope to achieve when we talk about testimonials and the expectations of them, is making a difference. For us, testimonials are learning opportunities. We want people to ask questions, not just of our story and about us, but about patient safety incidents in general, and how can they make a difference. So let me just walk you through an example. So 2 years ago, I underwent hip replacement surgery. After the surgery, the pain specialist came into my room and asked me on a scale of 0 to 10, what was my pain like? And I said 0. I had 0 pain after the surgery. It was amazing compared to before the surgery, where 2 years I experienced a lot of pain. And then he asked me, so what did you do for your pain management? And I said, over-the-counter drugs, Tylenol, Advil, Aleve. I couldn't tolerate opioids or anything with codeine. And so really that was my basic care, and using a cane and taking care of myself. And he indicated to me that I was going to experience a lot of pain, so he was going to prescribe something for me to control it and get ahead of it before it became really bad. So he prescribed an opioid intravenously, which took me into a tailspin. My heart was pounding and racing. I had no idea what was happening to me. I was breathing quickly. I was fading in and out, and I was terrified. I honestly thought that I was going to die. I did go unconscious for over 24 hours. The last thing I remember is the healthcare nurse beside me asking for a crash card, and I was crashing. When I woke up 24 hours later, my husband was with me, the nurses were there, and the nurse bent over and said to me, I am so very sorry this happened. We should have listened to you. We made a mistake. That was an apology. And it was an understanding between her and me that something had happened. It almost cost me my life. So what happens after that? What now after the incident? Well, then we go through a bit of a review or inquiry, the understanding, the mutual healing, looking at the incident response and how we can do a better job at that. And that's really leading into the what next. Identifying concerns, exploring recommendations, looking at all the options. Trying to figure out what are the factors that were involved there, system-related, human-related, other factors. And also talking to other patients and finding out what their experiences were. We found out there were others that had similar experiences, and so a panel was actually struck. So this was a learning opportunity. We had an opportunity to make changes in terms of pain management post-surgery. We asked a lot of what ifs. What if I had been listened to about my opioid experience and I couldn't tolerate it? What if I had been listened to about my pain being 0? What if there was another choice that I had? Couldn't we start in the middle of the range of medications as opposed to the top of the range? So this is what creates the safety. It allows everyone to have a role. We listen, observe, and perceive. We're proactive. And I'm trying to understand the situation and making some changes, because the curiosity and inquiry around this leads into those learning opportunities, and we lead into practice changes. Here's an example, of course, of a team steps improvement strategy, but there are many others. What we want to do is to have shared commitments for safer care and improvements. We want to have the capacity to be able to speak up, to communicate, looking at the situation, opportunities, and the motivation to make changes. In the end, what we really want is to make sure that people understand what patient safety incidents are all about, that they can be harmful, not just to patients and their families and caregivers, but to healthcare providers. We're all part of the same journey. And we want to understand, too, how to embed patient safety into our language, our practice, preventing incidents and harm, that everybody has a role to play in it. We all need to be heading in the same direction to improve patient safety and prevent patient safety incidents. We want to ensure that our care is safe and respectful. I mean, that is really what testimonials and expectations are all about. So thank you very much, and I do hope that you have an enjoyable session and discussion. I look forward to follow-up from this, and all the very best.
Thank you very much, Dr. Burns. And indeed, as mentioned, the testimonials, those experiences of patients are learning opportunities, and I believe this summit is a very good platform to present these testimonials and narratives and stories from patients so that actions can be done to improve patient safety. Now, ladies and gentlemen, we will proceed to a crucial plenary session where expert insights will be distilled into core messages for our esteemed ministers. This session, titled Core Messages from Experts to Ministers, aims to provide actionable recommendations and key takeaways to drive policy and action on patient safety. We are honored to have two distinguished speakers deliver these vital messages. First, please join me in welcoming Ms. Stephanie Newell, Patient Safety Advocate and convener of the Australian Patient Safety Network. And second, we will hear from Dr. Helen Ong Garcia, Vice President and Head of Quality and Patient Safety at St. Luke's Medical Center, Philippines. Ms. Newell and Dr. Ong Garcia, we eagerly anticipate your critical insights and recommendations. Please, let's give them a big round of applause.
Good morning, everybody. How are you all? So I'm Stephanie Newell, and I'm a patient safety advocate, and I'm also a founding member of the World Health Organisation's Patient for Patient Safety, and also convener of the Australian Patient Safety Network. And the network is a group of patient leaders that have a high level of understanding and knowledge in patient safety and patient partnership. We all have a lived experience of being harmed in healthcare, and we collaborate as individuals and collectively across all aspects of healthcare on patient safety issues. Safety is not optional for patients. Patients expect to be kept safe in healthcare. Distilling it down to three core elements of what patients expect. These are, they expect to be partners in their own care, to be listened to, their care to be connected up. But often their experience is one of being treated, one of not being treated as respected partners. Their input is dismissed, and care and systems are not seamless, and they fall through the gaps in care. So by experience, these expectations become concerns for patients. It's no surprise that each of these core elements are major factors in patient safety incidents. When harm occurs, patients expect, So when harm occurs, patients expect openness and transparency. They expect their experience to be listened to and that it's taken into account for solutions. And they expect to be supported after being harmed. Patients also expect that the health professionals involved and the organisation and the system as a whole will learn from what happened to them, because they don't want what happened to them to ever happen to someone else. Ensuring that others are not harmed in healthcare is a major motivator for those of us who are patient safety advocates. The World Health Assembly calls for the involvement of patients, especially those who have been harmed in healthcare, and for them to be involved in patient safety solutions. The perspectives and involvement of patients who have experienced harm is critical in patient safety policies and initiatives, because we have experienced a patient safety failure, and our view and filter is from a patient safety lens. We have witnessed by experience the gaps in care and systems, and therefore can contribute to solutions in a way that strengthens the success of the practical application of policies and initiatives. We also provide a bigger picture perspective to policies, as our experiences give us insight across the silos within healthcare. And we are solutions and future focused. We look beyond current practices so as to inform and co-create policies and initiatives and practices which bring safe care to patients faster. I'd like to share with you 2 examples that are detailed there in the circles. And these are historical and both occurred around 2009. But the reason I illustrate them is because it demonstrates the involvement of patients who have been harmed in healthcare, how they can bring a different viewpoint and one that is patient-focused. And it's a catalyst for change that is embedded throughout the system and brings a really sustainable endpoint and product as a result. So when the South Australian Health Department, which is my home state, was planning the first ever statewide patient safety culture survey of all healthcare staff in 2009, members of the Health Department's Safety and Quality Patient Advisory Committee requested that an inpatient survey of patient safety culture occur in parallel with the staff survey. It hadn't been considered to ask questions of patients as well. I was chair of that committee, and all of us on the committee had experienced healthcare harm. So we developed the 25 questions of the inpatient survey, and the questions specifically focused on patient experience of safety. The questions we developed asked patients about their experience of feeling safe and of being partners in their care. And some of the questions included if they were informed by staff how to raise a concern with their care, how confident patients felt that the healthcare staff would tell them that there had been an error made in their care, and their expectation of who would tell them if an error had been made. Did they want a doctor that was involved in the error to tell them? Did they want a doctor that wasn't involved in that error to tell them? Or was it to be a nurse? Or would they prefer an administrator to do this? The development of the patient safety questions by patients who had experienced harm was novel, and as the questions being asked were about the experience of patient safety, not satisfaction with care, as was the usual case at the time to ask about if people were satisfied with the care they received. This was also pre the Australian Open Disclosure Framework, which was implemented in 2012. And this survey was the first time in Australia that patients had been asked about their experience of patient safety culture, and that the patient survey questions were developed by consumers. Patient leaders were then involved in the development of the Australian Hospital Patient Experience Question Set, which is a national question set used across Australia in hospitals. The second example is also from 2009, which is the WHO, the World Health Organization, Australian for Patient Safety Workshop. Excuse me. This workshop brought together patients and family from across Australia who had experienced healthcare harm, health professionals and policymakers to advance safety reform, to advance patient safety reform in Australia. The workshop participants developed the Perth Declaration for Patient Safety. The Perth Declaration was included in the Australian Commission on Safety and Quality's publication on patient-centred care, improving quality and safety through partnerships with consumers. And the workshop contributed to the policy reforms which elevated partnering with consumers or patients as a key focus area. A pivotal time for Australia was the implementation of the National Safety and Quality Standards in 2011, and critically, the development of the Partnering with Consumers standard. And this standard focuses on partnerships with consumers, patients, within the governance structures of the healthcare organisations, and its inclusion across all other national standards, clinical and clinical governance as well. Many patient leaders were involved in advisory committees and forums for the development of the standard, and the national standards and the partnering with consumers has been critical to embedding partnership with patients across healthcare service organisations. Ministers, you have an important role for change. Patient leaders with experiences of patient safety, errors and failures can play a critical role in identifying solutions for policy and initiatives. Please take a top-down and bottom-up approach. Bring patient leaders together and listen to them and work on patient safety issues and solutions together. Ensure they are at the table where policy is made, and replicate what we did with the World Health Organization Patients for Patient Safety workshop. Bring all players together. It's key that we all have a seat at the table together. Patient leaders with lived experience of patient safety failure can contribute to the implementation of the Global Patient Safety Action Plan and propel and strengthen current and future policies. Patient leaders with experience of patient safety can provide information and education on patient safety to healthcare staff, and also to patient groups and community to build their understanding on patient safety. Not all patient organisations are like the Philippines patients organisation that we just heard from and understand what patient safety is. So we need to provide that information to them so they can identify those errors that have just been pointed out. And yesterday we heard from the lead of the organisation, Ms. Karen Villanueva, around the mandate from the World Health Organization to include social participation in patient safety. So yesterday we heard from Sir Liam, and he talked about Malcolm Gladwell, and Malcolm Gladwell, who's well known around the world, he didn't know about patient safety. So if Malcolm Gladwell didn't know, then the greater population of the world certainly don't know about patient safety either. So patient safety must be mainstream. Inform your community on what you are doing to keep them safe. People need to know how you're caring for them and keeping them safe. Create broad policies and initiatives with patient safety as a focus. Focus on those elements like a Charter of Rights that include patients in the creation of those documents. And elevate your advisory councils to be advisory councils that are safety and quality advisory councils, so that patients and those representatives on those committees and advisory councils get to see and understand safety and quality data and information and what's happening within healthcare organisations and systems. There's been a lot said about the economics of patient safety and the contribution that patients with a lived experience of patient harm can bring, and patients in general, is high impact and low cost, but ultimately the contribution that they bring is priceless. Thank you very much.
Thank you very much, Ms. Stephanie Newell. Now let's hear it from Dr. Ong Garcia.
Good morning. I'm sorry, I was informed that the podium is quite short for me. so that I was advised to use a microphone. I'll use both just in case. I now realize that I should not have brought my iPad because it's right in front of me. Thank you very much to the organizing committee. Good morning, esteemed ministers and vice ministers of the different countries, the very good working group of the WHO, the DOH, our Secretary of Health, and of course, the working group of DOH and also of ADB, distinguished speakers, panelists, resource persons, colleagues, and guests. Thank you for this opportunity to give everyone an encapsulated polypill of what had happened yesterday. So I'm given the task to give this in a very, very concise manner and some insights on what was discussed yesterday. Today, I'm supposed to give the core messages from the experts to the ministers. And this is exactly what happened with the productive meeting yesterday, starting from the very start of the morning until the afternoon. And I hope in the next few minutes I'll be able to highlight some of the things that were discussed, what are important, and perhaps what can the ministers harvest coming from this talk yesterday. And I say it is really a wealth of experts. First and foremost, the first talk was about the implementation of the Global Patient Safety Action Plan on 2021 to 2030, which was already cascaded very successfully. And there are several objectives, to be exact 7 objectives that already been focused on. And this is actually what is to be done. The question is to take action. Now we have different arenas and different environment in every country with regards how patient safety is all about. So therefore, what was actually seen as of 2024, the global assessment reveals that only about 1/3 have fully integrated patient safety into national strategies, with financial and human resource investment remaining limited. And that's true for a lot of countries. There's a lack of a systematic, widespread, standardized best practice safety management across different levels of national care. And therefore, there should be a realization that these plans, these 7 gold plans, should have an in-depth contextualization in accordance to your country's healthcare reality. Let's start from the ground. What do we have? How do we work on it? And where do we start? So to start, we need to embed a culture of safety within healthcare systems that requires more than a one-shot deal. It should be something that is planned. We try to actually learn from the other industries. Therefore, this is like an engineering plan. A plan to build a building. A plan to actually start a warfare. You need a strategy. And it demands a sustained commitment to governance, leadership, and of course, system-wide engagement. And this actually is two-way. You need top-down policies and bottom-up participation. And the role of the ministers are very clear. It's very difficult to become a minister of health. You have your boss to answer to, and you have people to command. Therefore, the strategy needs careful thinking, a very, very good planning, and not in a hurry to do that. Now my height is working against me. And therefore, that means you are there because you have the skill to actually do that both up and down. And of course, let us not forget, this is system-wide. It should not be the doctors alone, healthcare providers, it's a community. Therefore, involvement of the community, including patients' voices, should actually be something that we should take into account. This is a very nice slide I saw yesterday, which actually shows, and I'd like to thank the author for this slide, from the microsystem on how we can do patient reporting. The patient safety reporting and learning system should be there. How could we know what patient safety gaps we have if they are not reported? And this is very, very comprehensive and eloquent slide that shows how can it evolve from the bedside all the way to the global arena. But there's still work to be done. Again, we need to build a culture of openness and blame-free environment. It has to be involving healthcare providers, patients, families, and communities. There should be one language. So the work on a national level or even hospital level is an understanding what patient safety events are all about. There is already a wealth of information about what are patient safety events. Therefore, the taxonomy has to be standardized. That way, processes can be standardized. To each their own will not be the motto here. Because if you, as the ministers of health, could actually standardize the process across hospitals, and you have the authority and mandate to do it, it will equalize the practice in your respective countries. Therefore, high-level advocacy and investment in the people who will help you, the experts and technology, will be most appreciated. And therefore, after that, you can actually have and accrue data. And the power of unlimited potential of good aggregated and analyzed data will give you the opportunity to take actions towards sustainable improvement policies and capacity building in a national patient safety reporting system. Then it was discussed next about the role of patient engagement. It was very much comprehensively discussed by the two first speakers, and I will not anymore go into that. But I'd like to highlight perhaps that there will not be patient care without patient. There will not be patient safety without patient. And therefore the voice, and we're going to talk in the business language, they're the ultimate clients of patient care. So we believe in customer satisfaction in business sense. We also believe in the feedback mechanism of satisfaction of those we deliver care or services to, regardless whether it's health care or not. So it is important to engage them. And then by including patients, we have a lot of perks that we can actually get. One, better health education. They could be our ambassadors of what we're doing, so that miscommunication of what could have been a natural course of disease could be easily understood, and therefore there will be a collaborative effort towards improving patient care. We can have tools for advocacy, and we can actually have them participatory in terms of telling us how do we make sure that everything's in place, and their voice really matters. Next, then, they talk about mitigating the effects of climate change and patient safety. Partnerships are actually important. We cannot do this alone. Therefore, partnerships are essential in amplifying resources and expertise, strengthening resilience, driving innovation, and advancing global health, safety, and security. I'd like to highlight first one of the most unique partnerships we have now is a partnership between DOH and ADB. One finance institution and one health management system. Therefore, it means that it should really be a community-based effort. So it cannot be just the Ministry of Health alone. You have to have the buy-in of everyone in the community who will benefit from patient safety management. It means interdisciplinary collaboration so that we can identify risks earlier, and development of innovative strategies between patient safety and climate protection. So we need to actually have this in place and also evolve, because climate change is a reality. It's accepted in 60% already of the countries. We cannot deny it happens. Therefore, we cannot stagnate. I was just joking yesterday, I don't want to just stagnate. You may be popular as a Tyrannosaurus, but you're actually extinct. Nobody wants to be extinct. Patient safety management should also evolve. We should take into account Gen Z generations should also understand patient safety. That is inclusive of patient, technology introduction, and also the healthcare providers. Diagnostic safety was discussed eloquently. I like to beg the pardon for the wrong numbers. I'm there. Pardon me, I'm a doctor. I did not go into mathematics or economy because I'm poor with math. So pardon for that error, it's 17.5 already. But then there are realities to diagnostic safety. I know, just like the Philippines, we are starting to actually break down walls regards to the hierarchical way we handle patient care. It was mentioned yesterday, doctors are usually the ones who do not do cross-checking or validation whether their diagnoses are right or not. We're taking that steps. We need to break down that hierarchical wall that the doctor thinks, I know best, you know none. But then ChatGPT will change that. AI will change that. Globalization will change that. So now the future doctors should accept that it's a communication of a common understanding of what the disease process is and what the diagnosis is. That way we can reduce diagnostic errors. So there are limited access to tests in some of the countries. There are still fragmented care and even learning curves. And finally, the power imbalance I mentioned. And of course, health literacy gaps. Those are the first things we need to do before we can actually address systemic issues like communication barriers, clinical complexity, cultural barriers towards error learning, as mentioned. We always have to look back, reflect. Even in marital unions, we have to look back what went wrong. And that's something that we have to learn as a community. And therefore, we can probably move forward. And finally, this is what I call building the universe of diagnostic safety. Only the transparency and only with communication can we move forward. That way we have the fear of retribution, fear of litigation. In my own little hospital, the doctors are a little bit more transparent. Not much, just a little bit. We're still growing. Because they've learned the benefits that with transparency, there's little or actually lesser litigation, more communication, and therefore there's contextualization in my little community. The Philippines will come to that because we have to deal with each other's culture. So the advocacy of being presented yesterday, of starting from the curriculum up to practice policy, is something that will take decades. We know that learning takes decades, but it's a very good stop. So which means if we can incorporate patient safety into our schooling, nursing schooling, healthcare schooling, even among those individuals who have to know what patient safety is about, then we have a collaborative team in the future. Talking about leadership, therefore, this was already mentioned a while ago. I will not go through that anymore. Subsequently, sustainability. As mentioned, this should not be a one-time initiative. Investing in patient safety is both an ethical duty and an economic necessity. And therefore, much as we don't want to talk about money, but sustainability means money. Nothing can actually move forward without resources. And sometimes, what are the barriers to a sustainable healthcare? The resistance to change. That costs money. As long as they resist, change doesn't occur, we spend money for that resistance. The lack of standardized protocols break down anything that we want to innovate. Therefore, we always fall back. 2 steps forward, 1 step back. And underreporting is also an issue because with underreporting, we cannot actually get the true picture of the patient safety culture you have in your country. Therefore, workforce training is very important. You need to have standardized safety measure and to integrate it into medical education. And what are the perks? If this is in, you have sustained manpower reserves. Much as the Philippines love that you appreciate our nurses, but of course, you want your nurses to stay. You want people to go into healthcare training. Therefore, if they have a very good environment and training where they're at, they won't probably leave. Like number 2, you have sustained patient and client engagement. That transparency, that very good communication will make sure that you have a loyal client for a long period of time, and they're more than willing to help that health industry that makes them well. Reducing unnecessary treatments, sustainability while minimizing harm is exactly what I said. Streamline old processes that may cost money. And that's part also of sustainability, making sure that we actually make it easier, more value added for the patient. Therefore, you will improve the trust and efficiency of your country's population to the healthcare system. And of course, we cannot beat data-driven policymaking. Everything is evidence-based, and we can benchmark against international best practices. And this has to be a collaboration between the public and private entity so that it is a nationwide improvement. Now, regarding, as mentioned, if I say there's no patient care without patient, there's no healthcare providers without the said people who actually give the healthcare. So there is no effective way we can provide healthcare without people in the community of healthcare feeling safe. So the main point here is that how can I give patients safety if I don't feel safe? That's a realization I had with my own organization, and I have to say I work in a private institution where we promote patient care, but later on finding out that it's not being applied to the very people who deliver them. So it is actually, it's part of leadership. There's a huge gap in the understanding of what is safe environment among those who are the leaders of an organization or a Ministry of Health, compared to what is the perception of the bedside nurses, the practitioners on the forefront. So this needs communication, because that way we can keep them inspired, innovative, and collaborative. So there's a need for a practical, immersive engagement among healthcare workers to successfully promote a culture of safety. I do appreciate that nationwide patient safety culture that was done, which also includes the healthcare workers and the patient. That makes you give a very good picture of what is the patient safety culture of your area of scope of well, I'll keep it that. I'm running out of English. Scope. There will never be worker safety. Where there's no healthcare workers, there will be no healthcare. So equally, everyone is important in this universe that we work in. How about building resilient healthcare system? As mentioned, we do not exist alone. Without good infrastructures, we cannot exist as a good healthcare industry. So climate resilient healthcare facilities should be there. The role of the financial institution should be encouraged to invest in climate resilient healthcare infrastructure, even processes. And also, an accreditation body must ensure that healthcare institution meet standards. So you have to also work with your other ministers of infrastructure, of finance, to make sure that you're in the same page. I know everyone wants very safe infrastructure. Nobody wants to be in an infrastructure that actually renders them unsafe. We recently had a fire in our little hospital, and I was very proud that the evacuation system was very, very well managed. There was no casualty. Unfortunately, we have too many commanders-in-chief. So therefore, that actually added a debriefing, and finally we're moving forward because everyone was talking about it, and we are working towards a better organization. And that means investment. Investment in human resources, governance, public health system that can respond effectively to climate change, whether it's earthquakes, fires, or even pandemics. Finally, the talk about AI. This is something new. The promise of AI, and we heard very much how much promising AI could be, from predictive diagnosis to self-management of patients, and even for improved monitoring of AE and more knowledge for patients. We appreciated that it was highlighted yesterday. There are different types of AI, medical grade and commercial grade, and it is the duty of the healthcare providers to actually differentiate that and discuss that with patients. That way, patients don't feel anxiety. Anxiety is an underdiagnosed entity. I would probably say that's one of the #1 cause of morbidity among our patient population, and we fail to address that. So information that with guidance and professional collaboration would actually help our patient. So we need training. We need to learn that learning inadequacies should be addressed, and this needs high-level expertise. Remember, ChatGPT evolved because we contributed to the algorithm that made ChatGPT. A medical-grade AI needs our help too. That way our patients will have the confidence that the information they get are exactly the information that we think would be best for them. There could be AI bias, as was mentioned yesterday, and that should be addressed. Therefore, it was mentioned that some of the AI technology you have might not be applicable to the country that you're working in. So it would be best that you also contextualize the type of AI use and its applicability. And again, the very common DNA among humanity, resistance to change. That's very difficult to address, but needs to be addressed. And the adoption will be actually needing a regulatory framework coming from the Ministers of Health. There should be an upgrade in the learning and implementation schemes for all stakeholders. And of course, we have to protect the data and the privacy of our patients. And who else could tell us best but our patients themselves? So in a nutshell, I'd like to actually I lack one slide. In a nutshell, was talking about the fact that it should actually come from a strategy. People have been asking us, how do you strategize inputting patient safety and hoping that you could actually reach several levels, as was said in the Global Patient Safety Action Plan that was mentioned But then I would say start smart, choose the strength that your countries have, work on that. Get dedicated, not necessarily pro bono, but of course, it's your charm. You can get pro bono people who will work for you, but dedicated people who are willing to invest time, train them, invest in them. Have the infrastructure there. I was just saying, ministers of health have different roles to play. You're a salesman. You have to sell the idea to your boss, to the president, to the leader of your country. You are also a strategist, because with the resources you have to actually come up with a plan. You can have start focus. I don't want to say start small, because starting small is actually belittling the activity you're going to do. Start focus, work on your strength. Try to find out what is most needed in your country, make an impact, and that will be the role model that will cascade across the country and probably convince leaders of countries that patient safety should be a priority and not a minority. With that, I'm very privileged to deliver this message. Thank you.
Thank you very much, Dr. Helen Ong Garcia, for your critical insights and for that comprehensive presentation of core messages from experts to ministers. Now, let us move on to a pivotal segment of our program, a summit host panel discussion on sustaining momentum, the role of healthcare leaders in advancing patient safety through the global ministerial summits. We are honored to have with us previous hosts of the global ministerial summits from around the globe, each committed to leading the charge in patient safety. We will begin by introducing, ladies and gentlemen, our session chair who will lead this crucial discussion, Dr. Teodoro S. Herbosa, the Secretary of Health of the Philippines. Let's give him please a big round of applause. And now please join me in welcoming our distinguished panelists, William Vinal, Director, NHS Quality, Patient Safety and Investigations, Department of Health and Social Care, England, United Kingdom. Professor Dr. Edgar Franke, Parliamentary State Secretary, Federal Ministry of Health, Germany. His Excellency Sakoy Masami, Chief Medical and Global Health Officer, Vice Minister for Health, Ministry of Health, Labor and Welfare, Government of Japan. Dr. Ali Taleh Asseri, Director General of the Saudi Patient Safety Center and Head of Delegation Saudi Arabia, and Director General Saudi Patient Safety Center. Dr. Isaac Searcher, Senior Policy Advisor, Swiss Focal Point for Global Patient Safety and International Digitalization, and the Head of Delegation Federal Office of Public Health, Switzerland. And Dr. Mauro Orsini, Ministry's Prevention and Control of Healthcare Associated Infections Program Unit, Ministry of Chile. We look forward to a dynamic and insightful discussion on how we can collectively advance patient safety and eliminate avoidable harm in healthcare. I give the floor now to Secretary Teodoro S. Herbosa.
Thank you very much. Good morning, everyone, excellencies, ministers, esteemed colleagues, and distinguished guests. Leadership in patient safety is not just an aspiration. It's an urgent necessity. As leaders, we recognize that for patient safety to be truly embedded in our healthcare systems, institutions must be strengthened, frameworks and policies must be enforced, infrastructures and processes must be optimized, and resources must be mobilized and allocated equitably. But leadership in patient safety goes beyond policies and regulations. It demands action. It requires the courage to challenge outdated systems, the vision to implement transformative change, and the unwavering commitment to ensure that no life is lost due to preventable harm. We must recognize that patient safety is a journey, one that calls for continuous improvement, shared accountability, and a relentless pursuit of excellence. As the Secretary of Health and the leader of health in this country, the host, I'm honored to be the one asking questions instead of answering them. I'm honored to chair this session. It's entitled, The Role of Healthcare Leadership in Advancing Patient Safety. This patient safety remains a global health priority, and our collective leadership is vital in driving sustainable improvements across healthcare systems worldwide. In this session, we will not only discuss strategies, but also focus on tangible actions, how we can sustain this momentum, translate our commitments into meaningful outcomes, and reinforce our role as healthcare leaders in advancing patient safety through these global ministerial summits. Before we begin our discussions, I extend my heartfelt gratitude to our esteemed panelists who have all, like me, hosted the previous global ministerial summits, and for their invaluable contributions for joining us today. Let's give them a big hand. Our panel is divided into 3 segments. The first segment is the background on global ministerial summits for patient safety. And then we'll discuss the updates on global commitments to patient safety. And lastly, we will tackle sustaining momentum and strengthening the future of our global summits. So to begin, let's reflect on the origins that motivated the Global Ministerial Summits for Patient Safety. And I would request Mr. Winkle to answer. Could you share your insights on how the inaugural summit in the UK was initiated and its foundational objectives?
Yes, thank you very much. As somebody involved in the establishment of the first summit in the UK in 2016, I wanted on behalf of the United Kingdom government to thank you, Secretary Herbosa, and the Philippines government for your excellent hosting of this year's summit. It is an honour to be here and attend the conference on behalf of our ministers. This year's summit embodies all the reasons the summit series was established. As we heard this morning, the burden and the cost of unsafe care cannot be ignored. Previously, there were limited opportunities for experts to engage with ministers and countries to interact, and we needed really more political airtime because patient safety is a complex issue and improvements are gradual. And as you said yesterday, Dr. Herbosa, patient safety should be a tapestry of collaboration amongst governments. And I think together, all of us, we've achieved this over the last 10 years, and it's true to the vision established by our Secretary of State, Jeremy Hunt, and Hermann Grohe in Germany, to have a scientific program in the first day making recommendations and ministers' attendance on the second day. We're really pleased that this structure has maintained, and we're even more pleased that of the 7 summits, 4, more than half, have been outside Europe rather than in. So we can say the summit is truly global. And I think in conclusion, the summit series has given the permanent visibility to patient safety, which is what we wanted to achieve in 2016.
Thank you very much. And our second question goes to our previous hosts, Switzerland and Chile. Mr. Zerker from Switzerland and Dr. Brignole. What motivated your respective ministries in Switzerland and Chile to host the subsequent summits? Maybe Mr. Zerker first.
Yes, thank you, Secretary Herbosa, and your team for hosting an excellent summit. Really impressive achievement. Excellencies, dear ladies and gentlemen, dear colleagues, it's really an honor, a pleasure to share the stage with such esteemed panelists, and I'm happy to be here today. So now, what motivated Switzerland to host this valuable event? I think this is undisputed here in this room, and simply put, it remains, patient safety remains a pressing topic in public global health. And this is not true just at the global level, but also, as well as to the national level. So, and I think we also all agree that there have been some significant, or several, or many significant developments in past years, but I think we also have still quite a long way to go, and this is where international cooperation comes in. Switzerland actually considers the summit, or this summit series, to be one of the most important platforms to foster patient safety. And in a related context, actually, patient safety and quality are part of our national health strategy and as well as of our health foreign policy. our situation was somewhat particular with the summit in Montreux because we were the first event after the pandemic, and our goal was really to revive the momentum created by our friends and colleagues and their earlier events. And we wanted to, I mentioned implementation or the gap we still have actually, and our goal was to revive not only momentum but also to show how implementation can be done in a variety of contexts, because awareness is largely in place, I think. But often it lacks adequate implementation, or sometimes interventions and measures are not, they are not in place at all. So we still have a lot to do. I think we, as I said, we managed to show how it could be done or it can be done, but of course it is not the end of the story, and we, as in Switzerland, are really looking forward to support future summits. Thank you.
Thank you. Mauro?
Thank you, Secretary Barbosa, Excellencies, ladies and gentlemen. It's quite an honor to be here. Well, I think there is a short answer and a long answer. The short answer is basically Switzerland asked us, and we say, yes, of course.
Can I say Chile asked us?
Exactly.
And I said, yes, of course.
Basically was the same. Who can resist Swiss diplomacy? I mean, no, sorry, for really. Well, that was a good reason. But the other one was basically our country has some culture regarding patient safety involved in many public policies of healthcare and quality. And we had the unique, and I mean really the unique chance to bring the summit for the first time to another region, as you do. By the way, congratulations, because it has been a great summit, really.
It's been great because all of you attended.
Thank you. So basically, even if it's a World Ministerial Summit, every region has its own cultural difference, its own priorities, even its different barriers. In the Americas, basically, not most of us speak English, as an example. So basically, we try to do the first summit in Spanish with translation in English. And we think that we had some success. The idea was basically to keep going, keep the momentum, and thanks, because you led us to keep going to another region. And I mean, the spirit of the summit is actually to be a global ministerial summit. So it was a great work. Thank you.
Thank you, Maro. Thank you for your kind words. Now I'll ask Dr. Azeri, from your perspective, how have the past and current summit hosts influenced global patient safety priorities?
Thank you, Secretary Barbosa. Thank you very much, Secretary Barbosa, and my congrats for the well-organized and successful summit. Well, establishing such a high-level gathering at global level, I believe it is a great move towards shaping patient safety and transforming also patient safety at that level. I believe the influence of the past and current summits comes in few points. For example, this indicates that patient safety is a global challenge, regardless of the language of the healthcare system, of the economic status of the country. We all share the challenges of patient safety because it's a human issue. The other point, these summits allows for knowledge sharing and experience exploration, not within the country, not even within the same, I would say, area or region, but across continents. So this made it to the level of getting ideas and experiences from across the globe. Also, those series of summits allowed for or kept the global momentum toward addressing patient safety issues. I was imagining if there was no summit at this level, probably we will not find that focus and push towards improving patient safety and making it always on the agenda of leaders and healthcare professionals. And my last point is that by selecting specific theme for each summit, this allowed for in-depth focus on specific challenges that each country or hosting country is suffering from, which allowed for contextualization of the solutions to that country. So I think these, all in all, indicates that those summits and the summits to come are critical for the patient safety industry.
Thank you, Dr. Acer. Actually, I'd like to add to that because someone from Saudi Arabia came to me because I was proposing the creation of a global patient safety fund. To be surprised that the Kingdom of Saudi Arabia actually proposed it after that summit. And I probably helped revive that, and I discussed it this morning with my colleagues from the Asian Development Bank. And I think we will get a copy of your proposal and try to update it so that this momentum continues. So that's one of the accomplishments of Saudi Arabia, I think. Thank you very much for that one.
Thank you. Glad to hear that. Thank you.
Now the next questions, I'd like to ask Vice Minister Sakoy and Professor Dr. Frank. Could you provide key examples of how ministers of health have championed patient safety reforms in Japan and in Germany? Japan first.
Thank you. Thank you, Mr. Chen. And also, I would like to join the echo of congratulating this great summit opportunity. Thank you once again. First, we must acknowledge that serious medical accidents have the power to shake not only public confidence in individual hospitals, but also trust in the healthcare system as a whole. When such incidents occur, it is essential for the Minister of Health to demonstrate strong leadership, articulating a clear vision and pushing forward necessary reforms to enhance patient safety. I would like to share our concrete example about 10 years ago. Several major university hospitals faced severe criticism for inadequate responses to serious medical accidents. Investigation reveals their profound governance failure, particularly in how these hospitals oversaw patient safety. This situation had undermined public trust in advanced medical care and highlighted the need for decisive intervention at the highest level. Recognizing the urgency, the Minister of Health at the time set up the dedicated task force to address these systematic issues. The task force conducted on-site inspections of university hospitals across the country, identifying a number of recurring patient safety issues. In response, the ministry enacted sweeping reform to strengthen internal controls, ensuring that hospital directors assume direct responsibility for patient safety management. Also, an external audit system to improve transparency and fortify regulation to secure the patient safety of cutting-edge medical treatment have been introduced. I would like to emphasize that this experience underscored important key lessons. Patient safety must always remain a top priority in healthcare policy, and a major policy reform requires leadership from the Minister of Health. This Japan's policy reform case has enacted our commitment to patient safety and ultimately led us to host the third Global Ministerial Summit on Patient Safety in Tokyo. reflecting our resolve to share lessons learned and collaborate with international partners. Thank you.
Thank you very much, Professor Dr. Frank.
First, patient safety is a key issue, ladies and gentlemen, that must be addressed in every healthcare reform. A major example of such a reform is the ongoing hospital reform in Germany. The reform aims to shift from focus on quantity to quality in hospital treatment. That's an important point in our reform in Germany. You have heard about that. We are focusing on hospitals with the right staff, equipment, and experience. The reform is especially difficult because people need to understand, especially that small hospitals may not always be the best choice of treatment. It's important to ensure transparency about which treatment are available and their quality, so people can make an informed decision. That's quite important in our discussion in Germany. Second, another example is our work on error reporting and learning systems. That's also a quite important point for us. We have invested substantial resources into innovation fund to support research on the one hand, and into improving the systems for patient safety.
Wonderful experiences, and thank you for all the great inputs on how the global ministerial summits had evolved over the past 7 summits. Our next discussion point is actually on the updates on global commitments to patient safety. And my first question is directed to Dr. Aseri again and His Excellency Vice Minister Sakoy. Could you update us on new policies or initiatives that the countries have implemented following those commitments you mentioned?
Thank you very much. We had the privilege of organizing the 4th Global Ministerial Patient Safety Summit in Jeddah, Saudi Arabia. And I believe that it wouldn't have come in a better time because the Saudi Patient Safety Center was established in 2017. So that was perfect timing to lead or at least give some direction for the center at its infancy. And I'm privileged to have my colleague Abdullah Hussawi here, who was the organizer for that summit and the leader of the center at that point of time. So that summit has ended with the Jeddah Declaration, which had more than about 11 items. So I'll touch just quickly on what we have done out of those commitments so far. And it's a journey, improving patient safety. We will never reach to a point we'll say that's the end of it. We reached everything because it is, something that we need to keep developing and improving over time. So one of the items was talking about promoting patient safety in LMIC, and the center, Saudi Patient Safety Center, as a WHO collaborating center on policies and strategies, has led many initiatives in some of the LMICs, including training, establishing reporting systems, and others. Also, we established a national reporting and learning system in the country, and it is a hub for reports across the country, and that made a lot of difference because before that, it was sectorial and organization based. So every organization reports by its own, but now we have a single hub of getting all the reports, which allows for country-level comparisons and also getting informing the decision makers and patient safety issues. And we are planning to improve further on that by moving from responsive or reactive to being more proactive and predictive. Along the same token, we initiated a national project to establish patient safety indicators with the context of country context, because when we searched the market, we found hundreds of indicators. So we said, which one will suit us at that point of time? So that project helped us a lot measure and decide on what exactly is important for us at that point of time. And also we established patient safety standards because we found, people are claiming, organizations are claiming that we are compliant to standards, but which standards you are complying with? So we had country-specific standards that had also looked into international standards, and we are planning to use that to create sort of competition in a positive sense between organizations and health sectors in the country to follow patient safety standards. Not to take a long time, I'll just mention that we released a report for the best practice in nurse to patient ratio, because we found that this is something that was not focused on, and it was or was one of the major root causes for patient safety incidents. The not enough number of nurses taking care of patients, or the ratio was not appropriate, and that's something that helped to improve patient safety in that regard. In terms of workforce knowledge, we started mid last year to implement WHO patient safety curriculum on all health, health colleges in the kingdom, and this is something very important. I'll end up by we expect that healthcare professionals are aware about patient safety, but this is not true. Not always the case. So we built a foundational course for patient safety that will be mandated to all healthcare professionals, at least at the onboarding phase. Then it will be repeated frequently to make sure that they know the basics and they are updated with the new developments in patient safety. So these are some of the things that we have done, and it's a journey, and a lot will come in the future.
It's a lot, but I think I'll mention Liam. Sir Liam? Is Liam here? They're G-sapping already. These countries are G-sapping. Can I go to the Vice Minister of Japan, please, for your commitments that were done?
Thank you. At the third Global Ministerial Summit on Patient Safety in 2018, the Tokyo Declaration called on participating nations to strive to take global action on patient safety, including the establishment of September 17 as World Patient Safety Day. Soon after, the World Health Assembly officially designated World Patient Safety Day in 2019. Since then, the Japanese Health Ministry has marked World Patient Safety Day each year by uniting all stakeholders devoted to patient safety. For instance, in response to each such national call, landmarks across the country, such as castles and temples, have been illuminated in orange, the theme color for patient safety, showing our shared determination to protect patients. The Tokyo Declaration also highlights the importance of patient and family involvement in all aspects of safe and high-quality healthcare, and encourages their active role in safety efforts. From the early stage of our national program on patient safety, we involved patient delegates to join policy discussions. Their voices as the key participants in healthcare advanced our safety measures. At the hospital level, we have supported open dialogue between patients and healthcare workers, helping patients become more engaged in their own care. Drawing on this history of patient engagement and following our leadership in Tokyo Declaration, the Ministry of Health has deepened its commitment to involve patients at every stage, since we see it as vital not only to guide hospital-level activities, but also to raise public awareness across the nation. In line with this vision, in 2024, last year, Japan launched a mass media campaign, making a poster and a video alongside the popular medical drama on TV that reached about 20% of the population viewers. This campaign gave citizens opportunities to recognize patient safety as a personal matter. From our experience, I'm convinced that when leaders gather at summits and commit to shared goal, especially when a country hosts a summit and adopts its own declaration, it tremendously strengthens the country's patient safety initiatives. In Japan's case, hosting the summit and adopting the Tokyo Declaration clearly moved our efforts forward. Thank you very much.
Thank you so much. Those are interesting accomplishments that I think we will document because of this panel. But I'd like to go forward, and my time is running up, but I'd like to ask Dr. Zerker and Mr. Viñal, how does your government measure the success of strategies aimed at improving patient safety at both national and regional levels? Dr. Zerker first.
Yes, thank you. I think I have to focus on the operational level here. And the main tool or body in Switzerland is an independent commission of well-known experts or well-established experts. And their main task is to support the Swiss government in developing or fostering quality and safety in healthcare. And what they can do, or what they are doing, is they can mandate and fund concrete projects to foster patient safety. For example, currently we have the establishment of an online platform to foster patient engagement, and this platform is to provide information and training and networking opportunities, and the hope is to produce, if you will, more patient safety champions in Switzerland who are really able and competent to support other patients in standing up for their cause and interests. That's one thing. Or actually I have to mention that this commission has to provide a yearly report to the Swiss government, which is then adopted. So it has some visibility as well and some political legitimacy. But self-assessment is really important, but as equally important is as the outside perspective. And that's where, for example, WHO and OECD come in. Their reports and studies are really valuable to us. It helps us analyzing our own policies and progress. And also, very importantly, it allows for comparison to other countries, which has a really valuable learning effect. For example, I'm thinking about the WHO survey among member states with this very useful report with those very clear visualizations, with the score indicators. It helps also communicate at the national level. And of course, also very well-known OECD studies on the economics of patient safety, which allows us to show really impressive and worrisome at sometimes numbers. And also, let's not forget their reports on governance in patient safety, which were also really useful. So it's a combination, I think, of national and international or outside measurement, which is really allowing us to monitor our progress and to draw our lessons learned and get better. Thank you.
Thank you. Mr.
Thank you. Well, as we discussed yesterday, there isn't a single objective, reliable measure for patient safety, say like polio that Liam mentioned. So that means that measurement matters even more for the UK. The UK published a patient safety strategy in 2019 to drive better patient safety culture, better patient safety systems, and better measure improvements. And by our calculations, after 6 years, we have now saved 1,000 lives and £100 million in care costs. Now, to Anthony's point yesterday, that is steady progress, but we could be more dynamic. Part of the change has been improved reporting. We had been, and maybe still to some extent, have more data that we can usefully manage, but we now have two slightly less snappy acronyms than GSAPPing, but we have learning from patient safety events, which is about real-time reporting, and patient safety incident response framework, which is to focus learning on improvement rather than just examining incidents for their own sake. And allied to that, 1.5 million staff have completed patient safety training as part of the patient safety syllabus. We then have a range of other measures, some of which were mentioned yesterday. Martha's Rule that Henrietta Hughes mentioned, which is a second review prompted by failures in care and psychological deterioration, usually, as we heard this morning, prompted by the interests of families. We now have the Patient Safety Commissioner in the shape of Henrietta Hughes to have voice as a permanent feature of our patient safety system. And as Rosie Bennyworth said yesterday, we've started to professionalise the investigations function, which has so far been an unqualified discipline, which is why some investigations weren't helpful in the past. The government continues to champion the duty of candour, which is to encourage openness between clinicians and patients, as discussed this morning. And finally, last September, we introduced our system of medical examiners. We've obviously had a coronial system for many years to look at the most complex deaths, but for the 80% of deaths, i.e. most deaths that don't go to the coroner, there is now a review by a medical examiner to first of all give an explanation to the family of why the death occurred, and secondly to look at any unusual patterns of deaths which can then be followed up. So as you said yesterday, Secretary Herbosa, it's a tapestry of policies, not a single initiative to improve patient safety.
Thank you very much, Mr. Vignal. I'm trying to catch the time because I'm looking at my clock, and I'm going to eat some of your break time, if you don't mind. Professor Dr. Frank, what strategies have been proven most effective in overcoming political, financial, and operational challenges in patient safety implementation in Germany?
I'm short, yeah. But I'm talk about the Germany hospital reform, and I visit 150 hospitals in the last 2 years. It's quite a lot, 150 hospitals, and careful listen to the experience of the doctors, of the nurses, patients, and hospital managers. And the next step is to firm. Even when the facing political opposition, as a politician, you must have the courage to make difficult, sometimes unpopular decisions when you are justified, when you have the right decision. And that's a situation in Germany. A discussion if the reform was the advantages and so on, and we discuss this in all themes, but the simple message is to gain acceptance for healthcare reforms, you must listen to those affected and involve them. That's perhaps is a solution.
Thank you. I can relate to all the things you said, actually, as a Secretary of Health in the Philippines. I will go to the third part of the discussion, which is about how to sustain this momentum and strengthen the direction of our future summit. So the first question is again to Vice Minister Sakoy. How does Japan maintain a high level of political commitment to national patient safety policies aligned with the international frameworks like the WHO Global Patient Safety Action Plan?
Thank you. As national health policy leaders, we share the profound responsibility to ensure that every patient receives care without harm. Today, I'd like to emphasize 3 key points to maintain and strengthen the momentum around patient safety, both internationally and within each of our nations. First, we must acknowledge that the multidimensional nature of political momentum. Patient safety relies not only on government policies, but also on public awareness and robust institutional frameworks. A one-time crisis or a single isolated incident can spark attention. Actually, our major patient safety reform began after the serious medical accident with undermining public trust in the healthcare system. And it also created intense pressure on the Ministry of Health. Over the past quarter-century, this pressure evolves into sustained reforms. Therefore, while a crisis may initially trigger momentum, deliberate strategy such as regular assessments, clear metrics, and transparent reporting are required to keep it alive for a long term. Second, we should harness international cooperation. Ministerial gathering, as well as platforms such as the summit, enable us to exchange best practices, set global benchmarks, and collectively push for higher standards. By participating in international action plans, cooperative studies, or global patient safety surveys, such as each country can evaluate its own performance and be motivated to pursue continuous improvements. And finally, we must unify stakeholders under strong leadership while actively creating avenues for constructive pressure. Government officials, healthcare providers, professional associations, and patient advocacy groups should cooperate in an ecosystem where each party offers both solution and critiques. Concrete steps include publicizing patient safety measures, engaging in dialogue with healthcare professionals and experts to identify on-the-ground challenges, and joining international assessments such as the GPSAP to benchmark national progress. Moreover, by pledging leadership in forums like this ministerial summit, we sustain political will at the highest level. High-level champions, whether ministerial or recognized experts, can preserve continuities through political transitions and ensure that momentum does not fade. Thank you very much.
Thank you very much, Vice Minister. My next question is for Dr. Zerker and Mr. Viñal again. From your experiences, what does it take for a country to become a summit host, and what are the key considerations involved?
Thank you.
I think...
well, it obviously takes quite a lot of organisation, as you will know. It takes quite a lot of lead-in time, and it is a lot of work. But most of all, it takes political commitment, because from that all else flows. And if you have the political commitment, you can get the diplomatic leadership, you can maintain the uniqueness of the events, and you can gather in the expert speakers that makes it a stimulating occasion. So I think overall it's important that we keep the profile of the series up. Summits, as well as galvanizing activity in an individual country, can take it to a wider region as well, so can have significant impact. I think developing a pipeline of future hosts is important. And obviously now that we have the advantage of World Patient Safety Day, which, as was mentioned, started in 2019, a couple of years after these summits were established, to make stronger links between those two events, I think will keep the momentum of this summit series going.
Thank you. Dr. Sir.
Thank you. Yes, I have no news here, because on my note it says commitment is key. So we agree, I think, not very surprisingly. But it's not only, it's political commitment, that's true, but it's also commitment on all levels, or at all levels which are involved. So from the involved collaborators in the organizing team or wherever, all up to the highest level. And I think we saw that, for example, with the co-founding countries of the summit, whose enthusiasm and commitment really paved the way to the summit series success. And it also made it possible that we really can honor to this day the label global. So in addition to that, I'd say international cooperation is very important, especially at ministerial level, because it helps ensuring the high-level character of the event. Then I guess you need a team of really skilled, well-renowned experts who can really help you ensure that the program covers the important topics. Then a strong global network is key. Also regarding the topics, in order to try to cover the priorities around the globe. Of course, it's not possible to cover all of it. And let's also not forget the national level. I think, at least in our case also, it was important to get the national stakeholders on board, patients, hospitals, healthcare providers, doctors, because I think, or we realized that the summit is an excellent opportunity also to foster patient safety at the national level. So it's both national and international aspects have to be considered, I'd say. Thank you.
Thank you. Maybe at this point I'll actually disclose how I really got the hosting, because I wasn't the first choice of Chile. It was actually Singapore. Where's Kenneth? It was Singapore, and Kenneth looked at me and said, "Are you willing to host? Because we can host in 2027." So I ended up hosting it. I'm still looking for a host. There's a country that approached me who's interested. After hearing the commitments, maybe these countries will be able to come to us and be able to tell us they're willing to host 2026. So we're looking for that brave, committed country to host the next global patient safety meeting. Professor Dr. Frank, how can we ensure that continuity and long-term commitment from governments toward patient safety initiatives?
Yeah, the challenges of patient safety are different in every country due to the varying healthcare system in each. But visibility and public pressure at the vital of our patient safety everywhere. The summit at all and the Mandalong Declaration, which we support, are playing really an important role. The summit has brought patient safety back into the political agenda, not only in Asia, not only in Philippines, also in Europe, and also in Berlin. Namely, just yesterday, Germany's leading healthcare newspaper reported on the significant gaps we still need to address in this area. You know, and therefore this is patient safety made it challenges all over the world, and therefore we are. I would like to thank you that we have not only a good organization from this important summit, but also for the good cooperation in the other levels. And I say thank you for that.
Thank you so much. We go to the last question. I want Dr. Brignol and Dr. Aceri to answer the last question. In your view as previous hosts, what are the crucial roles of WHO and the other international organizations and stakeholders in supporting summits like this? And how has their involvement influenced the outcomes that you held in global summits that you held in your country? Yes.
Thank you very much. No doubt, WHO and other global organizations are critical. Their role is critical in keeping the summits going on, and also in ensuring that the recommendations are implemented. So I'll take the opportunity and thank Dr. Neelam, who was so supportive during her term in WHO, and the current leader of patient safety, Dr. Irina. So the WHO, from their role as steering committee member, they work hand in hand with the hosts, previous hosts, and the current hosts to ensure that the agenda is set in a way that will help to implement the Global Patient Safety Action Plan and other international priorities. During the summit, also the addressing the summit by the DG speaks of how committed is WHO to supporting the summits and patient safety in general. And also after the summit, the WHO creates sort of, or maintains sort of platform for countries to share their experiences and ideas and learn from each other. I will not forget to mention the important role of ISQA and OECD in presenting the data during the summits, and also their valuable reports that helps a lot in indicating where the international community is improving and where do they need to focus on along the journey of improving patient safety at a global level. So without those important organizations, countries cannot work, because we work hand in hand, countrywide, and also organizations to reach to the aim of improving patient safety at a global level.
Thank you so much, Mauro. Last words.
So I'm going to be quickly. Where is the next host?
There are several interested. No one has finalized.
Well, a short message, something that we learn is that we engage the patient, the international and national organizations, our stakeholders, too late. So key message, engage them from the beginning of the organization of the summit. From the beginning.
The beginning.
Your life is going to be so much easy. And also, if you do it wisely, especially with the national stakeholders, the accountability process, it's going to be so much easy. And WHO, thank you. You just gave us a beautiful tool, that's the GSAP. Now, it's our duty to use the GSAP wisely to plan our national and local interventions. And I think that probably the GSAP should be the basic of the next program for the next and the next and the next summit. And we hope that on the next summit, it's time to also get some kind of accountability for what are we seeing with the GSAP. So thanks a lot.
Thank you very much, Maura. And with that, I'd like to thank all my panelists, actually. They are the ones, that will volunteer for 2026. All of us are committed to actually help you lead a better global summit than this one in Mandaluyong City. So in closing, as we conclude this vital discussion, let us reflect on the key actions to sustain the momentum of the global ministerial summits on patient safety and translate our commitments into a lasting impact. First, let us move from dialogue to action. Let's go GSAPPing. Ensuring that the insights and strategies shared here are integrated into national healthcare policies and implemented with urgency. Patient safety cannot be treated as an isolated agenda. It must be embedded in every aspect of our healthcare systems. Second, we must strengthen collaboration and accountability. True progress in patient safety requires a global effort, one that transcends borders, shares best practices, and fosters collective responsibility. The global ministerial summits must continue to serve as a platform for learning, innovation, and coordinated action among nations. Third, we must invest in the future of patient safety. This means dedicating resources to improve healthcare infrastructure, advancing workforce training, and leveraging digital innovations that enhance patient safety. It also means empowering patients, ensuring that they play an active role in their own care. Fourth, we must challenge the status quo, challenge the toothbrush, and drive innovation forward. Sustaining momentum is not an easy task. It requires bold thinking, fresh perspectives, and the courage to break away from the outdated systems. To truly transform our efforts, we must build a comprehensive and sustainable infrastructure that propels patient safety forward. This could mean establishing a dedicated funding mechanism that countries can access to support patient safety initiatives, such as the mechanism would not only provide essential resources, but also serve as an incentive for nations to implement and institutionalize patient safety practices within their healthcare systems. By investing in structural changes, we can ensure that patient safety is not just a temporary focus, but a permanent and evolving global priority. To all the global health leaders and policymakers here, I leave you with this message. Patient safety is not just a healthcare priority. It is a human right. Every patient in every country deserves care that is safe, effective, and free from preventable harm. The true measure of our leadership is not in the policies we write, but in the lives we protect. Finally, I encourage our participating countries to step forward and continue hosting these crucial summits. Your leadership is essential in sustaining this movement and ensuring that patient safety remains a global imperative by hosting future summits. You will not only advance the conversation, but will also drive meaningful change within your own healthcare systems, and as we saw in the discussions previously. Let us leave this summit with renewed commitment, shared purpose, and the determination to build a world where patient safety is a reality for all. Thank you very much, and thank you to all our panelists and previous hosts.
Once again, thank you to our esteemed panelists and to Secretary Teodoro J. Herbosa. Please, another big round of applause for that meaningful summit host panel discussion. Thank you very much. At this point, we'll have a 10-minute health break. So please enjoy the food and beverage outside our venue, and then we'll see you after 10 minutes to resume our program. Thank you.
Galing. Ha? Kasi nakita kita yun. Iseng Paulo. Ito na siya. Ganito rin sa kabila.
to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
This partnership will harness the strengths of both countries to improve health outcomes and foster international cooperation through joint efforts in health.
Together, let us strengthen the weave of patient safety, thread by thread, policy by policy, life by life. Because in the Philippines, we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat, and once again, mabuhay. Welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
sa lahat ng Luzon, Visayas at Mindanao ng mga ospital ng Department of Health, itinataguyod namin ang pagbalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the
Good morning. May we invite everybody to come back inside, please, the main hall, as we will begin and resume the program in some few minutes. Again, may we invite everybody to come back inside the main hall as we will resume the program in a few minutes. Thank you.
Since yung tatay ko po is a cancer patient and status po is stroke, mapa-anesthesiologist, sa IM, sa surgery na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa ko. Hindi lang po dito nagtatapos dito sa hospital ang pakikuugnayan ng mga healthcare worker dito sa hospitals kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi syempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks inalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffrey Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, lagi nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Dinadetalye po nila yung gagawin po sa sakit niya. Nararamdaman ko talaga na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols, such as the patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta, kahit hindi ko kailangan.
Yung tiwala po namin sa kanila para mas lumalim pa po.
To all our patients at Western Visayas Medical Center,
as you come in here, we would like to take care of you.
We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
The most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department, most of our patients has difficulty of saying. companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
We have the safety plan, we have additional safety coming. Doon nakapaload na lahat ng components, the procedures that we need to take in order to maintain yung safety. Hindi lang sa patient, this includes watchers, visitors, and even the staff itself.
The most important part of my job as healthcare professional is providing.
Good morning. May we request everybody to kindly settle down, please, as we will resume the program shortly. Again, requesting everybody to kindly settle down as we will resume with our program shortly. Thank you. Good noon, everyone, and welcome back. Now we arrive at a significant moment in our summit, a moment that marks the collective commitment to the future of patient safety. We will now present the Mandaluyong Declaration, a testament to the shared vision and actionable strategies developed during the discussions. And to guide us through this important segment, please join me in welcoming the chairs of the DOH Organizing Committee, Undersecretary Kenneth Ronquillo and Undersecretary Paulo Teston.
Your Excellencies, distinguished delegates, esteemed colleagues, it is with great honor and deep sense of responsibility that we stand before you to present the Mandaluyong Declaration, one of the key outcomes of the 7th Global Ministerial Summit on Patient Safety. After rounds of consultations with member states, we have finally reached consensus. Let this declaration be a testament to our united stance that patient safety is not optional, it is fundamental.
The Mandaluyong Declaration on Patient Safety. We, the Patient Safety Weavers, gathered at the 7th Global Ministerial Summit on Patient Safety in Mandaluyong, Philippines on April 3 to 4, 2025, building upon the principles and outcomes of all previous summits, London 2016, Bonn 2017, Tokyo 2018, Jeddah 2019, Montreux 2023, and Santiago 2024, including the Tokyo Declaration, Jeddah Declaration, Montreux Charter, and Santiago Commitment Charter, reaffirm our unwavering determination to make patient safety a universal imperative. Our collective commitments align firmly with the World Health Assembly 72.6 resolution on global action on patient safety, as well as the corresponding Global Patient Safety Action Plan 2021 to 2030. With renewed urgency, we choose to advance our actions in establishing patient safety as a foundational pillar of resilient, people-centered, and equitable health systems that deliver high-quality care and drive improved health outcomes. Together, we pledge to 1. Strengthen global collaboration for patient safety by fostering joint efforts rooted in transparency, mutual accountability, and shared learning. Inspired by the Filipino tradition of bayanihan, which embodies the values of solidarity, collective responsibility, and a deep sense of community spirit, we will work together towards a common goal of improving patient safety and eliminating avoidable harm by creating a culture of safety across all health systems worldwide. Number 2, advance leadership and governance in patient safety by embedding patient safety at the highest levels of health system governance, prioritizing investments in patient safety at all levels of healthcare with an emphasis on primary care where the foundations of health are established. We will strengthen national leadership and governance structures that promote a culture of patient safety, drive accountability, nurture innovation, and ensure continuous improvement in health outcomes. 3. Integrate patient safety into disaster and emergency preparedness and climate resilience by incorporating patient safety considerations into disaster preparedness strategies and plans, recognizing the growing impact of climate change and disasters on health systems. We will foster synergistic partnerships to mitigate risks, ensure continuity of care during crisis, and build resilient, adaptive health systems that prioritize safety even in times of disruption. And 4, build a people-centered approach to patient safety by recognizing the utmost importance of weaving together and valuing the experiences and expertise of individuals, communities, and systems. We will strengthen inclusivity in decision-making and co-create solutions with the most affected by unsafe care, ensuring a people-centered, equitable, and sustainable future for patient safety.
Call to action. We commit to transform these pledges into concrete actions by strengthening patient safety leadership, promoting evidence-based and country-specific frameworks, fostering global collaboration and knowledge sharing, prioritizing healthcare workforce investments, leveraging artificial intelligence, digital health and emerging technology, addressing social, economic, and environmental factors, and engaging patients and families in safety initiatives, among others, to enhance patient safety and improve healthcare systems by designing and delivering safer care for patients and eliminating avoidable harm in a just and learning culture. We urge all governments, health organizations, healthcare facilities, and healthcare workers, the academia, civil societies, patients and their families, communities, and all relevant stakeholders to join this shared mission, ensuring that the principles of patient safety are embedded in the fabric of all health systems worldwide.
May we now call on the Secretary of Health, Dr. Teodoro J. Herbosa, for the formal adoption of the declaration. And in honor of the city that graciously hosted this summit, we'd also like to invite on stage the City Health Officer of the City of Mandaluyong, Dr. Arnold Abalos.
Please. The City Health Officer. Okay. On behalf of the Philippine Department of Health, and with the mandate entrusted to me by all of you present today, I humbly move for the adoption of the Mandaluyong Declaration. I encourage all member states to take this declaration back home, not just as a document, but as a blueprint for change. Let us commit to the principles, and let us take ownership of its goals, and let us be accountable for its results. Do we have an applause? Thank you. So I'll give it to him.
Oo nga, sir.
Once again, another round of applause for that Mandaluyong Declaration. Thank you very much to Yusek Ronquillo, Yusek Teston, and of course, Secretary Herbosa, and to Dr. Arnold Avalos. Now, ladies and gentlemen, I think it's time for a lunch break, and we invite everybody, please, for a lunch, and then we will resume with our afternoon program at 1:30 in the afternoon. See you after lunch. Thank you very much.
kahapon. Ay, wala kayo ganito.
lahat ng Luzon, Visayas at Mindanao ng mga ospital ng Department of Health, itinataguyod namin ang pagbalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the patient, watchers, and the other healthcare providers. Ini-ensure namin na walang medical error na mangyari. Importante na ma-orient ang ating mga pasyente about sa kanilang mga treatment plans.
Since yung tatay ko po is a cancer patient and status po is stroke, mapa-anesthesiologist, sa IM, sa surgery na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa. Hindi lang po dito nagtatapos dito sa hospital ang pakikuugnayan ng mga healthcare worker dito sa hospital kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi syempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks inalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffy Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, lagi nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Dinadetalye po nila yung gagawin po sa sakit niya. Nararamdaman ko talaga na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols, such as the patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta. Kahit hindi ko ano.
Yung tiwala po namin sa kanila para mas lumalim pa po.
To all our patients at Western Visayas Medical Center,
as you come in here, we would like to take care of you.
We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
The most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department, most of our patients has difficulty of sitting. companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
We have the safety plan, we have partition safety committee. Doon nakalpaloob na lahat ng components, the procedures that we need to take in order to maintain yung safety. Hindi lang sa patient, this include watchers, visitors, and even the staff itself.
The most important part of my job as healthcare professional in providing patient safety is to ensure a clear, accurate, timely communication ng healthcare professionals. A proper identification kung ano yung gamit na gagamitin, proper medication, proper dosage, no? And then proper identification and routing sa patient na pabibigyan natin.
Kung wala tayong proper communication, so it will hinder the care for our patients. This hospital see to it that almost all our employees will be sent for trainings for competency with the different specialties that we have in our institution.
Hindi mo ma-feel na parang iba ka sa kanila. Actually, nagbibigay talaga sila naglapas ng loob sa akin personally to fight.
Binabantayan ko po yung asawa ko na aksidente sa Korea. Pag in-explain na ng mga nurses or doctors, alam namin na okay talaga yun para sa pasyente rin. Maganda talaga yung pag-aalaga nila. Kahit wala ako or nagbili lang ako sa saglit, nandiyan po yung mga nurse doon.
We make sure that we care for the patient. It makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matris. Siyempre po, natatakot po ako na yun nga po, baka may cancer nga po. Sinabi nga po ng mga espesyalista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na lang ako magpa-work up.
Magkapit-bahay po kami. Tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses, mga admin po. Ina-address po nila yung infection control, medication safety, patient safety, procedure safety, and proper communication po, and teamwork collaboration. Number one na importante sa infection health control or infection control would be hand hygiene, yung proper hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, sine-check din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness, sila yung mga patulog-tulog.
Sa safety procedures po ng laboratories or extraction ng blood, importante number 1, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanino lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga konsultan, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang may papangako lang po sana at ang pinaka-importanting magagawa namin as ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, okay po, satisfied naman po sa kanila. Kampante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Jose Reyes ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety.
Welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
This partnership will harness the strengths of both countries to improve
foster international cooperation through joint efforts in health.
Together, let us strengthen the weave of patient safety, thread by thread, policy by policy, life by life. Because in the Philippines, we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat, and once again, mabuhay. Welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
Sa lahat ng Luzon, Visayas at Mindanao ng mga ospital ng Department of Health, itinataguyod namin ang pagpalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the patient, watchers, and the other healthcare providers. Ini-ensure namin na walang medical error na mangyari. Importante na ma-orient ang ating mga pasyente about sa kanilang mga treatment plans. Since yung tatay ko po is a cancer patient and status post-stroke, mapa-anesthesiologist, sa IM, sa surgery, na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa. Hindi lang po dito nagtatapos dito sa hospital ang pakikugnayan ng mga healthcare worker dito sa hospitals kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi syempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks na inalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffy Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, lagi nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Binadetalye po nila yung gagawin po sa sakit niya. Nararamdaman po talaga namin na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols, such as the patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta, kahit hindi ko ano.
Yung tiwala po namin sa kanila para mas lumalim pa po.
To all our patients at Western Visayas Medical Center,
as you come in here, we would like to take care of you.
We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
The most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department at all, most of our patients has difficulty of safety. Companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
We have the safety plan, we have additional safety committee. Doon nakalpaloob na lahat ng components, the procedures that we need to take in order to maintain yung safety. Hindi lang sa patient, this includes watchers, visitors, and even the staff itself.
The most important part of my job as healthcare professional in providing patient safety is to ensure a clear, accurate, timely communication ng healthcare professionals. A proper identification kung ano yung gamit na gagamitin, proper medication, proper dosage, no? And then proper identification and routing sa patient na pabibigyan natin.
Kung wala tayong proper communication, so it will hinder the care for our patients. This hospital see to it that almost all our employees will be sent for trainings for competency with the different specialties that we have in our institution.
Hindi mo ma-feel na parang iba ka sa kanila. Actually, nag-training talaga sila naglapas ng loob sa akin personally to fight.
Binabantayan ko po yung asawa ko na aksidente sa kuya ko. Pag in-explain na ng mga nurses or doctors, alam namin na okay talaga yun para sa pasyente nito. Maganda talaga yung pag-aalaga nila. Kahit wala ako or nagbili lang ako sa saglit, nandiyan din po yung mga nurse doon.
sure that we care for the patient, it makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matris. Siyempre po, natatakot po ako na ayun nga po, baka may cancer nga po. Sinabi nga po ng mga espesyalista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na rin ako magpa-work up.
Magkapit-bahay po kami, tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses, mga admin po. Ina-address po nila yung infection control, medication safety, patient safety, procedure safety, and proper communication po, and teamwork collaboration. Number one na importante sa infection health control or infection control would be hand hygiene, yung proper hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, chine-check din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness sila, yung mga patulog-tulog. Sa safety procedures po ng laboratories or extraction ng blood, importante number one, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanina lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga consultant, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang maipapangako lang po sana at ang pinaka-importanting magagawa namin as nurses is yung ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, ano po, okay po, satisfied naman po sa kanila. Kampante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Ministerial ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety. It is a great honor to welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
This partnership will harness the strengths of both countries to improve health outcomes and foster international cooperation through joint efforts in health.
Together, let us strengthen the weave of patient safety, thread by thread, policy by policy, life by life. Because in the Philippines, we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat, and once again, mabuhay. Welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
Sa lahat ng Luzon, Visayas at Mindanao ng mga ospital ng Department of Health, itinataguyod namin ang pagpalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the patient, watchers, and the other healthcare providers. Ini-ensure namin na walang medical error na mangyari. Importante na ma-orient ang ating mga pasyente about sa kanilang mga treatment plans. Since yung tatay ko po is a cancer patient and status po is stroke, mapa-anesthesiologist, sa IM, sa surgery na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa. Hindi lang po dito nagtatapos dito sa hospital ang pagkikaugnayan ng mga healthcare worker dito sa hospitals kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi siyempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks nilalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffy Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, lagi nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Dinadetalye po nila yung gagawin po sa sakit niya. Nararamdaman po talaga namin na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols such as the patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta. Kahit hindi ko ano.
Yung tiwala po namin sa kanila parang mas lumalim pa po.
To all our patients at Western Visayas Medical Center.
As you come in here, we would like to take care of you.
We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
The most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department, most of our patients has difficulty of seeing. companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
With yung safety plan, may patient safety committee. Doon nagpapaloob na lahat ng components, procedures that we need to take in order to maintain yung safety. Hindi lang sa patient, the single watchers, basic and even the staff itself.
The most important part of my job as healthcare professional in providing patient safety is to ensure a clear, accurate, timely communication ng healthcare professionals. A proper identification kung ano yung gamit na gagamitin, proper medication, proper dosage, no? And then proper identification and routing sa patient na pabibigyan natin.
Kung wala tayong proper communication, so it will hinder the care for our patients. This hospital see to it that almost all our employees will be sent for trainings for competency with the different specialties that we have in our institution.
Hindi mo ma-feel na parang iba ka sa kanila. Actually, nagbibigay talaga sila, naglapas ng loob sa akin personally to fight.
Binabantayan ko po yung asawa ko na aksidente sa proyekto. Pag in-explain na ng mga nurses or doctors, alam namin na okay talaga yun para sa pasyente nito. Maganda talaga yung pag-aalaga nila. Kahit wala ako or nagbili lang ako saglit, nandiyan din po yung mga nurse nito.
Make sure that we care for the patient. It makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matris. Siyempre po, natatakot po ako na yun nga po, baka may cancer nga po. Sinabi nga po ng mga espesyalista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na lang ako magpa-work up.
Magkapit-bahay po kami, tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses, mga admin po. Ina-address po nila yung infection control, medication safety, patient safety, procedure safety, and proper communication po, and teamwork collaboration. Number one na importante sa infection health control or infection control would be hand hygiene, yung proper hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, chine-check din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness, sila yung mga patulog-tulog. Sa safety procedures po ng laboratories or extraction ng blood, importante number 1, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanino lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga consultant, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang may papangako lang po sana at ang pinaka-importanting magagawa namin as nurses is yung ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, okay po, satisfied naman po sa kanila. Ang pante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Jose Reyes ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety. Welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
of both countries to improve health outcomes and foster international cooperation through joint efforts in health.
Together, let us strengthen the weave of patient safety. Thread by thread, policy by policy, life by life. Because in the Philippines we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat and once again, mabuhay. Welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
Sa lahat ng Luzon, Visayas at Mindanao ng mga ospital ng Department of Health, itinataguyod namin ang pagpalaganap ng patient safety. Meron kaming mga patient safety committee, patient safety officer, at lahat ng doktor, nurse at mga personnel ay nakatutok sa patient safety.
Dito sa Mariano Marcos Memorial Hospital and Medical Center, binibigyan din natin ang halaga ng kaligtasan ng ating mga pasyente. Meron tayong tinatawag na quality check or quality maintenance check. Everyday nagagawa yan ng mga operators natin so that yung result ay makakatulong sa mga doctors natin at nurses sa pag-diagnose at paggamot sa ating mga pasyente.
When they come to us and they need our expertise, we have to always explain yung mga sakit nila properly dun sa level na kanila po dapat naintindihan.
We are the bridge between the patient, watchers, and the other healthcare providers. Ini-ensure namin na walang medical error na mangyari. Importante na ma-orient ang ating mga pasyente about sa kanilang mga treatment plans.
Since yung tatay ko po is a cancer patient and status stroke, mapa-anesthesiologist, sa IM, sa surgery na doktor, pumupunta lahat sila, sir, kung may nararamdaman po yung papa ko. Hindi lang po dito nagtatapos dito sa hospital ang pakikuugnayan ng mga healthcare worker dito sa hospital kasi tinuturuan din kami kung paano namin alagaan yung tatay namin pag-discharge namin dito sa hospital.
Kompleto sila sa gamit since level 3 DOH hospital to. Maraming mga espesyalista, magagaling yung mga doktor. Nung kakapanganak ko lang, hindi ako makababa kasi syempre cesarean section. So at that time, wala akong ibang magawa kundi magtiwala dun sa staff. Super thankful po ako kasi more than 3 weeks inalagaan nila kaming mabuti. Hindi masusurvive ng twins kung wala sila.
Ako po si Joffy Bernas, isang pasyente po na may sakit sa puso. Yung isa sa nagtatak sa isip ko, yung nasa ICU ako, na yung nurse hindi nawawala sa paningin mo, laging nakatutok sa'yo. And then yung mga doktor, explain kung anong kondisyon mo.
Dinadetalye po nila yung gagawin po sa sakit namin. Nararamdaman ko talaga namin na concern sila po sa kondisyon po ng mister ko.
It is important that we ensure that proper procedures are being followed because it prevents errors and it builds trust.
To prevent infection, we make sure that we are updated to the protocols, such as that patients are taught on how to do proper hand hygiene and also proper waste disposal.
Our patients are admitted to certain wards wherein they are classified as either infectious or non-infectious so that there will be lesser chances of patient infecting another patient.
The environment is conducive for the wellness of our patients so that the personnel management as well as their practices will contribute to patient safety.
Communication is the key to safety. When patients understand what's going on, they're more likely to follow instructions properly and voice any concerns.
May mga tao pala na ganun pala pag magsuporta. Kahit hindi ko paano.
Yung tiwala po namin sa kanila para mas lumalim pa po.
To all our patients at Western Visayas Medical Center,
as you come in here, we would like to take care of you.
We try our best to put safety of the utmost importance.
We take our responsibility seriously.
We're not just treating a patient, we are caring for a person. We care about their safety, and their safety is at the forefront of everything we do.
The most important part, especially when it comes to patient safety, is that assuring that our patient feels safe. Here at our department at all, most of our patients has difficulty of seeing. Companionship or their watchers is really, really important, especially if they're going to be admitted in our hospital.
We have the safety plan, we have safety coming. Doon nakalpaloob na lahat ng components, the procedures that we need to take in order to maintain safety. Hindi lang sa patient, this includes watchers, visitors, and even the staff itself.
The most important part of my job as healthcare professional providing patient safety is to ensure a clear, accurate, timely communication ng healthcare professionals. A proper identification kung ano yung gamit na gagamitin, proper medication, proper dosage, no? And then proper identification and routing sa patient na pagbibigyan natin.
Kung wala tayong proper communication, so it will hinder the care for our patients. This hospital see to it that almost all our employees will be sent for trainings for competency with the different specialties that we have in our institution.
Hindi mo ma-feel na parang iba ka sa kanila. Actually, nagbibigay talaga sila naglapas ng loob sa akin personally to fight.
Binabantayan ko po yung asawa ko na aksidente sa proyekto. Pag in-explain na ng mga nurses or doctors, alam namin na okay talaga yun para sa pasyente rin. Maganda talaga yung pag-aalaga nila kahit wala ako or nagbili lang ako sa saglit, nandiyan din po yung mga nurse doon.
We make sure that we care for the patient. It makes their life different. You also feel good dahil nakatulong ka sa kapwa mo.
Ako po si Imelda Celestino, 65 years old. Kaya po ako nagpunta ng hospital kasi nag-bleed po ako. Sa resulta ng biopsy, meron daw po akong bukol sa matris. Siyempre po, natatakot po ako na ayun nga po, baka may cancer nga po. Sinabi nga po ng mga espesyalista sa yung consultant na di naman daw po nakakatakot magpa-chemo. Marami naman daw pong mga senior citizen na gumagaling. Kaya nag-decide na rin ako magpa-work up.
Magkapit-bahay po kami, tita ko po siya. Tuwing ina-admit siya, ako po yung bantay niya lagi. Sinabi po ng anak niya na bukol sa ovary. Pero magagamot naman po. Kaya palakasin namin yung loob ni tita. Parang wala lang, parang nag-staycation lang po kami sa ospital. Parang family din namin yung mga nurse dito. Hindi po sila nagsasawang pumasyal para magtanong kung may kailangan.
Ang role ko po as a nurse is yung siguraduhin yung safety ng patient. At the same time po is yung magawa po yung mga plans ng mga doktor and then ma-carry out po yung mga care na dapat sa kanya at maibigay yung mga gamot niya. Sobrang importante po na maramdaman niyang safe kasi po yung buhay po kasi niya, binibigay na niya sa pangangalaga namin, sa aming mga nurses, pati sa mga doktor. So malaking bagay po yun na parang may trust po siya sa amin.
Dito sa aming hospital, meron po kaming Patient Safety Committee. Ang aming Patient Safety Committee ay kinocompose ng doctors, nurses, mga admin po. Ina-address po nila yung infection control, medication safety, patient safety, procedure safety, and proper communication po, and teamwork collaboration. Number one na importante sa infection health control or infection control would be hand hygiene, yung proper hand washing. Minimake sure din natin na bago pumasok yung pasyente, yung safety or yung sterilization ng area. Aside from that, chine-check din natin yung mga procedure safety. Napaka-importante ng makuha natin ang consent ng patient. Kasi magpapakita ito na napaliwanag mo sa pasyente kung ano yung mga kailangan niya at dapat niyang malaman bago mo maisagawa yung isang procedure. Napaka-importante ng patient tagging kasi ito yung mag-identify sa patient. Napaka-importante ng sirens, lalo na sa mga bata, sa mga matatanda, at saka yung mga pasyente natin na hindi talaga yung normal yung level of consciousness sila, yung mga patulog-tulog. Sa safety procedures po ng laboratories or extraction ng blood, importante number one, kailangan malaman mo ba kung tamang pasyente ba yung kukunan mo ng dugo. Kasi hindi ka po pwedeng kumuha ng dugo kung kani-kanino lang pasyente. Sa infection and sanitation protocols po, meron tayong mga sulat sa bawat corner ng ating hospital kung paano po gagawin ito. Aside from that, yung patient communication. Kasi napaka-importante, nakakausapin natin yung pasyente.
Araw-araw po sila, inilagaan po nila ako. Araw-araw po sila nagra-rounds. Lalo na po yung mga consultant, mga nurses namin. Tapos po sa Euro, maga pa lang po nagde-dressing na po sila ng sugat.
Sa mga bantay na parehas ko, magtiwala din sila sa mga nurse, sa mga staff. Kasi sila yung parang pamilya mo rin dito. Hindi rin iba yung treatment nila. Kahit bantay ka, yung attention kay tita, inaanuhan din nila sa'yo para hindi ka rin magkasakit.
Wala naman pong fix sa buhay. May gagaling, may hindi. Pero ang may papangako lang po sana at ang pinaka-importanting magagawa namin as nurses is yung ma-ensure ang patient safety habang andito po sila sa aming pangangalaga.
Ako, proud ako, not only for myself, but also sa mga team namin, sa lahat ng mga staff dito sa hospital. As a doctor, I live by, of course, serving the patients first. Because for me, ang importante is improving the lives of the patient and making a difference in the patient's life as well as to the relatives.
Pakiramdam ko dito po sa mga nurses, sa mga staff, okay po, satisfied naman po sa kanila. Kampante naman po sila na safe ako sa hospital na ito. Kaya po, maraming po salamat sa kanila.
Mga kababayan, tulad ni Nanay Imelda na pinangangalagaan ng Department of Health at ng Jose Reyes ang kanilang patient safety, ganyan din po ang gagawin namin sa lahat ng aming mga ospital at healthcare facilities. Pinangungunahan ng Department of Health ang pagtaguyod sa patient safety. Sa mga kamag-anak ng mga pasyenteng nagpapagaling sa mga DOH hospital, huwag po kayong mag-alala, kami po ay nakatutok sa kanilang patient safety. Welcome you to the 7th Global Ministerial Summit on Patient Safety, a gathering where we look forward to every year. Let this summit be more than a gathering. It should be a loom where we interlace ideas, share wisdom, and craft durable solutions.
WHO is privileged to co-sponsor this summit, reaffirming our shared commitment to ensuring safe healthcare for all. We believe that this summit is not just a moment of reflection, but a call to urgent action.
Harness the strengths of both countries to improve health outcomes and foster international cooperation through joint efforts in health.
Thread by thread, policy by policy, life by life. Because in the Philippines we say, bawat buhay mahalaga. That translates, every life is precious. Maraming salamat, and once again, mabuhay, welcome to the Philippines.
Let's come together with true recommitment and collective action to uphold the very foundation of patient care. First, to no harm.
Good afternoon again, everyone, and welcome to the second half of our Day 2 of the 7th Global Ministerial Summit on Patient Safety. And now we have a special message from a key partner in our efforts to strengthen healthcare systems and improve patient safety in the region. Please join me in welcoming Dr. Eduardo P. Banzon, Director, Human and Social Development Office, Sectors Group 3, Asian Development Bank, WHO, who will share a message on behalf of the Asian Development Bank. Let's give him a big round of applause, please.
Good afternoon. Ministers, good afternoon. It's always nice to talk right after lunch. Usually have nice memories of the lunch. So, Now, I think first of all, again, we would like to thank everyone for coming here in Manila. I'm a Filipino, so allow me as well that the Philippines has been a wonderful place for you in the last few days. So, and please continue to visit the Philippines. So, there will be more tourism that will come to the Philippines. But let me reiterate the message I said earlier in the panel, that we in the Asian Development Bank, we a bank that was established way back in 1966. The countries that you see here are the owners of ADB. It was set up to help countries, in a sense, address development needs. The bank is owned by the countries, resources is mobilized, and then of course, developing member countries, as we called it, are the ones that get access to this financing. When it started, it financed mostly what we call hard infrastructure. A lot of the roads, a lot of the power plants, a lot of the water systems in Asia and the Pacific were financed to ADB. 1971, I always love to tell this story, it started to do health. Believe it or not, it was Hong Kong and Singapore. Used the countries that borrowed to set up what became among those the polyclinics of Singapore and Hong Kong. Subsequent to that, of course, the ADB continued to support health, although we did not focus on health as much as we should have been doing until the pandemic. With the pandemic came, 20% of our portfolio in 2021 was actually to support countries for responding to the pandemic. And of course, subsequent to that, we have continued to scale up our support for health. And in particular, for universal health coverage. And as what we have said, for us in ADB, patient safety is critical for universal health coverage. I think the PAPO is here. So we hosted actually the Philippine PAPO, the first ever Philippine Patient Summit here in this very room, about late last year. Because again, consistent to our belief that you cannot talk UHC without talking about the patient. And frankly, that health reforms, as described by our speaker earlier in the panel, should always incorporate patient safety as part of the element. But we also recognize that when we start talking about patient safety, what do we actually mean by that? It means, of course, that we need health infrastructure and equipment to be there. Without good health infrastructure, patient safety would be difficult to do. Yes, we could say it can be done, but we believe that Asia should invest more in health infrastructure that is both resilient, that is low carbon. In a sense, it's time to upgrade, and we in ADB has been supporting a lot of our member countries in upgrading health infrastructure and equipment. But beyond that, as emphasized in this talk, health workforce. We need enough of them. If it's 1:20, one nurse to 20, 50 patients, it's impossible not to make mistakes. That's difficult. If the work conditions are bad, if they're made to work for 24 hours, you get tired. And once you become tired, you make mistakes. So the reality is we need to have enough of them. We need to capacitate them. We need to pay them enough, decent work conditions. And we need to make sure that they're well motivated, because we also know that poorly motivated workers in any sector will always have a tendency to make mistakes. So we in ADB are supporting that, including production of health workers, capacity building, and in many ways. I always love to emphasize that now is April, right? So 5 years ago, around March, we closed down ADB. I remember that. I was actually having lunch here. Then in the talk, we were told that one of those that we were talking with was actually with one of the first COVID-19 patients in the Philippines. I think, case number 7 and 8. Oh, you could imagine our panic. That was the last day I was in the bank until about a year and a half. Because we were told to go home, and we shut this down, and we were not allowed to come back here. The pandemic is something sometimes we all forget. It's just about 5 years ago, but it's not, it seems life have changed so much. But one of things I always emphasize is there's a lot of lessons in the pandemic that sometimes we forget. What did the pandemic show that? That real-time reporting is doable, that we could share surveillance data, that we could rapidly do warning systems, that we could actually work with the private sector, governments, you could work with the private sector to get information and data. A lot of the things that we need in order to have patient safety systems that can monitor, that can give advance warning, all that. So if it can be done then, why can't we do it now at the, with patient safety? The pandemic also showed us another thing, that health communications, that the health sector was actually very good in communicating things. We were creative. We used social media. We used traditional media. We did not limit ourselves to boring, usual health promotion messages, and actually came out with very elegant things that still, and so why do we seem to forget those things that we did, that was done during the pandemic, and use these very tools now also, so that we could communicate, we could increase health literacy on patient safety. One of the things that we also sometimes forget, that during the pandemic, we get the public, the private, the people, providers, population working together. Sorry, I just love to come out with nice acronyms, the 5 Ps. Right? We were actually working with each other. We know in order to move the patient safety agenda, we need all of this to work again. The public, which means government, the private, providers, population, and patients. So, time for the 5 Ps to be back. We also, and this is what sometimes I find interesting in Asia and the Pacific, health insurance is sometimes we forget as a tool. It's a very powerful tool. And we have seen that in government in developed countries, how the health purchaser is actually, how do we call that? It controls money, it knows how to purchase, it knows how to leverage money. I'm gonna have a question. So anybody here from the National Health Insurance Program of the Philippines? Anybody from PhilHealth? From BPJSK? From Ayushman? From the JKN program of India? Sorry, no health purchasers in this room. So I think we're missing something here. The ability of health purchasers to leverage their financing for things to happen. We talk about accreditation. Accreditation moves when the health insurance and the health purchasers takes action, not because the government or ministries of health are doing things. So I think you need to harness national health insurance programs, national purchasers, or whatever you call it, to drive the patient agenda. We also, of course, have to recognize that enabling policies have to be done. So I love that Annette Tan is here of the Department of Health. She's the one on top of hospital licensing, and we should always see hospital licensing. These are among the most powerful tools in order to push the patient safety. And in a sense, we in ADB, we actually have instruments when we when we engage countries called policy loans that actually works and disburse against policy actions. So this is something that probably in the future we could discuss. Finally, I love what our Deputy Minister of Japan talked about the Tokyo Declaration. I have to be honest, this is the first time I heard about the World Patient Safety Day. And for me, something in the words health sector, I feel, how do we call it, inadequate. Because I think I should have known about this, and this is something I should advocate. Because if there's one thing the health sector is good at, it's because we're very good in advocating these things. World TB Day. On Monday, I'll be with R.D. Saya for World Health Day. So we'll be joining him in Wipro. So we in ADB, we were committing this. We'll make sure that World Patient Safety Day will be known to all our member countries. We will help it owned by, again, the 5 Ps, the public, the private, the providers, make it 6, the purchasers, population, and patients. Because I think if we have a North Star, like World Patient Day, then we have a better chance of making this something that we don't have to celebrate in a summit, but becomes a norm on everyday health systems. In UHC, that when you see an UHC program, patient safety is not something you look for, it's actually up front and center. So again, welcome to ADB and looking forward to more summits that we can join.
Thank you once again, Dr. Eduardo P. Banzon of the Asian Development Bank. This time, we have a highly anticipated video message from a global leader in health whose vision and dedication guide the collective efforts in improving health outcomes worldwide. Let's listen in to the message of Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization.
Honorable Secretary Dr. Herbosa, Dr. Eduardo Benzon, Sir Liam Donaldson, Regional Director Piukala, Honorable Ministers and Delegates, dear colleagues and friends. Magandang umaga. I thank the government of the Philippines for its leadership in convening this global ministerial summit. It seems self-evident that nobody should be harmed while seeking care. And yet, unsafe care affects around 1 in 10 patients globally. About 12% of these adverse events lead to permanent disability or death. The WHO Global Patient Safety Report shows that unsafe care causes more than 3 million deaths globally each year. This tragedy is compounded by the fact that about half of all harm resulting from unsafe care is preventable. Patient safety must be a non-negotiable priority in all health systems, at all levels of care, in all communities, and at all income levels. WHO is committed to supporting countries to implement the Global Patient Safety Action Plan through partnerships, learning and innovation, and increased accountability through data and monitoring. Because if it's not safe, it's not care. Salamat po. I thank you.
Thank you once again, Dr. Tedros Adhanom Ghebreyesus. And now let us transition to a key segment of our program, the country statements. This plenary session serves as a platform for member states to share their national perspectives, initiatives, and commitments to patient safety. We'll be inviting each minister to the podium. And to open the country statements, we first welcome the WHO Western Pacific Regional Director to deliver the remarks. Let's give a big round of applause to Dr. Saya Maupiocala.
Dr. Eduardo Benson, the ADB representative, Secretary Herbosa, Honorable Ministers, Excellencies, colleagues, and friends. Magandang hapon and mabuhay. I think it's in the last 2 days, we had the privilege of being here in the Asian Development Bank. And I think we are all in this room, we are all in a safe space. We are right here at the bank where the money is. Over the past 2 days, we have heard powerful testimonies from patients who have lived through harm, difficult situations, difficult experiences, and from experts advancing safety in primary care and hospitals. We have also listened from leaders confronting the real-world challenges of implementation heads-on. And these conversations have reminded all of us that patient safety is not a code. It is a right to every patient rooted in dignity, equity, and trust that must exist between people and the systems that serve them. As a surgeon, I have lived this reality. There were moments when I stood alone as the only surgeon, facing the daunting reality of a setting without ICU, scarce supplies, and no peers to turn to for guidance. But you all know doing nothing meant losing a life. I had to take risk, not because I wanted to, but because the system offered no safer option. And I want to remind all of us in this room, there should never be a health worker be forced to choose between inaction and unsafe action. That is why we must embed safety into the design of our health systems, ensuring that reliability is built in and no longer dependent on individual acts on or of courage. I therefore strongly welcome the Mandaluyong Declaration. It captures the spirit of this summit, that safety must be built into every level of care, across sectors, across settings, and across societies. Let us leave Manila with this state of mind, that no patient will be left at risk because the system failed them. That safety will not depend on luck or sacrifice, but on good evidence, clear processes, empowered people, and cultures that learn. This is how we protect patient safety. And this is how we restore trust. This is how we honor our foundational promise to the people we serve. First, do no harm. Get it right. Make it safe. An ounce of prevention is worth a pound of cure. Safe travel to you all, and blessed weekend. Salamat po.
Thank you very much, Dr. Piocala. And now, we will be inviting each minister to the podium, starting off with the Minister of Health of the Kingdom of Eswatini.
Program Director and all protocol observed. Warm greetings from the Kingdom of Eswatini, a beautiful country between South Africa and Mozambique in Southern Africa. The government of Eswatini appreciates the invitation extended by His Excellency Dr. Theodore Herbosa, Secretary of Health of the Philippines, to participate in the 7th Global Ministerial Summit on Patient Safety. Patient safety is a core mandate of the Minister of Health in delivering healthcare services. The Constitution of Eswatini recognizes access to healthcare as a fundamental right for all citizens. In pursuit of improved patient safety, the country has undertaken several initiatives, including aligning with the WHO Global Patient Safety Action Plan 2021-2030, commemorating Patient Safety Day annually in September, establishing a quality program focused primarily on infection prevention and control, implementing initiatives from the pharmacovigilance and antimicrobial resistance control, though progress in these areas remains a challenge. Unfortunately, patient involvement in decision-making is still not fully established. However, we have organized patient groups advocating for members with special conditions, such as people living with HIV, those on renal dialysis, and persons with disabilities, just to mention a few. Others are also progressing in that direction. The ministry is also actively involved in social media platforms where patients interact with the ministry. The communication officer is responsible for updating the pages and complaints raised referred to the relevant departments. The minister is also following these pages and engage with patients and general public. Eswatini's participation in this summit has been invaluable. It has provided critical insights into the importance of patient safety at the policy level and introduced to innovative measures that can enhance healthcare systems. Moving forward, patient safety will be a key component of the ministry's agenda, ensuring safer healthcare delivery, which will translate to better health outcomes. Furthermore, Eswatini aligns itself with the Mangalyong Declaration, which emphasizes collaboration, leadership, governance, integration, and most importantly, a people-centered approach to healthcare. The government of Eswatini is committed to investing in patient safety measures and looks forward to reporting significant progress on these initiatives at the next Ministerial Summit. In conclusion, Eswatini appreciates and applauds the warm welcome and hospitality of the people of the Republic of the Philippines, from the airport to the hotels, security, protocol, everywhere. We thank you so much. Maraming salamat.
Now let's hear it from the Minister of Health of the Federated States of Micronesia.
Dr. Tetros, Dr. Saya, Dr. Eduardo Benson from ADB, Excellencies, distinguished delegates, ladies and gentlemen. A warm ka morale, as we say back home, and mabuhay to all of you. First, I thank the organizers for putting on an excellent summit on patient safety, making sure the agenda is filled with rich discussion on the technical intricacies, best practices, and the context in which patient safety is lived, experienced, influenced, formulated, pursued, and becomes part of our lives. Patient safety is our ethos as a global health community. If it's not yet part of our DNA, it should, and we should make it. We owe it to our people we serve, our patients, our customers from a business standpoint. Yesterday and today, I've been listening to the presentations, testimonies, and case studies, and all point to the need to upscale our investment in patient safety. You know what? You're right. Ensuring that no one is harmed in healthcare and every patient receives safe and respectful care is what we health ministers, healthcare providers, diagnosticians, policymakers, all about. This is our solemn truth, our oath, and our moral imperative. So, as a health minister, what will I do in the patient safety space after this excellent summit? Well, as a starting point, if my country has not filled out the global patient safety survey, I will see to it that we do. I will also take a closer look at how this can further our continuous improvement and quality assurance initiatives. Don't be surprised if I reach out to you, WHO, ADP partners, and ministers for technical assistance and support. Much of what has been discussed since yesterday resonate with me, and I'm sure the same with all of you. The agenda to having a sound patient safety culture, to having the framework in place, to ensuring that all patients are satisfied with the care they receive and we do no harm, is a developmental and transformative one. It's everyone's business. And lastly, I will remiss if I don't express my appreciation to the government of the Philippines, the Honorable Secretary Erboza, and your team for an excellent summit. You're an excellent host, and you always make us feel at home. My liaison officer and security officer, thank you very much for looking after me. Thank you.
Now let's hear it from the Minister of Health of the Republic of the Gambia.
Thank you very much. Dr. Teodora Herbosa, Honorable Secretary of Health, and your entire team. Colleague Honorable Ministers, Dr. Eduardo Benson of the ADB, patient safety experts, members of various delegations, distinguished guests, ladies and gentlemen, I bring you greetings from the smiling coast of Africa, the Gambia. I extend salutations of His Excellency President Adama Barrow to His Excellency President Ferdinand Romualdez Marcos Jr. and the people of the Philippines. I wish to acknowledge the warm hospitality of my brother and our host, Dr. Teodora J. Herbosa and his entire team. As we gather in the Philippines to discuss patient safety, it goes without saying that we are deliberating on one of the most important aspects of healthcare. Unfortunately, patient safety, teaching, and learning have not been emphasized on in the curriculum of many health teaching programs. In the Gambia, we do not have a specific patient safety unit or SOPs. However, the Gambia had implemented a World Bank-supported results-based financing RBF system, which used quality of care parameters that are scored and points awarded. These points are converted into monetary bonuses for health facility improvement and staff allowance top-ups. This, I must say, has been a very successful strategy as health facility staff were motivated to do their best and individuals served voluntarily to provide peer oversight functions as no one wanted to see their facility score less, meaning less bonuses for them. This RBF checklist is now serving as a quality of service checklist for our monitoring and evaluation unit. Participating in this 7th Global Ministerial Summit on Patient Safety, for me, is a big eye-opener. on what more can be done to improve on patient safety. Listening to the policymakers and the experts and patient advocates has given me an insight and enthusiasm to establish patient safety structures in the Gambia. As we adopt the Mandaluyong Declaration, I wish to say that I'm in a hurry to reach home to set up a patient safety unit for our ministry in the Gambia. As I close, I want to extend my sincere appreciation and gratitude to my brother and friend, Dr. Theodora Harbosa. I met him for the first time just yesterday, but it looks like we had known each other for a very long time. His warmth and hospitality and his leadership style are exemplary. Honorable Secretary, I'm not surprised that your staff are all very nice and hospitable. They are just like you. My liaison officer, liaison, security detail, and driver have all been very great. I must appreciate them. The venue, the food, and the music were superb. I think I will come back to the Philippines. Thank you very much for your kind attention. Thank you.
Next, let's hear it from the Minister of Health and Wellness of Jamaica.
Thank you very much. Mr. Secretary of Health, Dr. Harbosa, distinguished ministers, representatives of the WHO, delegates, friends one and all. Firstly, let me join my colleagues in saying my sincere appreciation to the Secretary of Health and his team for their warm hospitality. I had the privilege of hosting Dr. Harbosa in Jamaica recently, and I told him he could not outdo my hospitality in Jamaica. We're a tourist country, but so far he has, so I want to give him a big round of applause for that, and to say a big thank you to him and his team for the warm hospitality. So Jamaica acknowledges that reducing the risk of unnecessary harm to persons as they seek health care to the absolute acceptable minimum is a fundamental component of quality health care. We recognize that unsafe care can undermine public confidence and trust in our local health care service delivery establishments and potentially can adversely affect attainment of universal health coverage and the Sustainable Development Goals. We therefore support and have gone a distance in the development of strategies and coordinated activities to maintaining patient safety. At the national level, the inclusion of patient safety management into relevant policy manuals is advocated during their review and updating. Patient safety considerations will be addressed in the next iteration of several policy guidelines, including maternity care, accident and emergency, and neonatal care, to name just a few. At the same time, Jamaica's Ministry of Health and Wellness is supporting and strengthening local hospital quality assurance committees towards identifying, monitoring, and reporting on patient safety indicators. A new division, the Enabling Environment in Health and Client Services Division in the Ministry of Health and Wellness was created to provide strategic guidance related to improving and maintaining an optimal ambience during the provider-user interface. It is strategically poised to contribute to advancing patient safety, in addition to its current mandate of identifying, monitoring, reporting, conducting research, and addressing patient complaints and engaging patients and families in care. Of note, the latter is an arm of the 2021-2030 Global Patient Safety Action Plan. This division will also be at the vanguard of promoting a culture of safe care in our healthcare system. Operationally, routine audits are conducted to assess the extent of compliance to specific clinical guidelines, particularly in several areas where risk to the patient safety is high. These areas are designated MONIA, which means maternity, operating theater, nursery, intensive care, and accident and emergency areas. Findings are routinely reported and contribute to overall quality improvement initiatives. As we embark on this very important journey towards minimal harm to persons seeking health care, we recognize that policy support, resources, cultural changes, and new specializations will be critical in promoting patient safety. There is now an established and growing body of research and knowledge pertaining to patient safety. A lot of it we heard over the past day and a half. Safety science is now an established discipline of study with its own specialists, vocabulary, and conceptual frameworks. Additionally, the role of social science research and behavioral sciences should not be overlooked because of the cultural elements inherent in patient safety. We recognize that, as is happening in some jurisdictions, these specialists will play a critical role in healthcare going forward. Training and equipping such persons with the requisite knowledge and skill sets will further strengthen our health systems to address these challenges. Finally, and additionally, Mr. Secretary, we must seek regional partnerships and global synergies where necessary to address this global phenomenon. The government of Jamaica, therefore, reaffirms its commitment to advancing patient safety through respectful, beneficial, and sustainable engagements and collaboration. I thank you.
Next, we welcome the Minister of Health of the Republic of the Maldives.
Excellencies, ladies and gentlemen, Assalamu alaikum, and a very good afternoon to you all. The Republic of Maldives expresses its deep appreciation to the government of the Philippines for its visionary leadership in convening this important summit. We are grateful for the warm hospitality extended to our delegation. We fully support the global vision to eliminate avoidable harm in healthcare. Patient safety must be recognized as a fundamental discipline and a catalyst to accelerate progress towards universal health coverage. The Maldives recognizes the significance of the summit's overarching theme and remains resolutely committed to embedding it as a fundamental value across our entire healthcare continuum. While we have made significant progress in global health targets and the implementation of Global Patient Safety Action Plan, we also acknowledge challenges in execution of some strategies. We affirm our responsibility as policymakers and healthcare leaders to ensure that patient safety remains a fundamental priority across all health sector policies. Our focus on revitalizing primary healthcare further reinforces our unwavering commitment to patient safety. Our presidential pledge on digitalization and integration of artificial intelligence are poised to play a pivotal role in shaping a safer healthcare future, a cornerstone in unlocking the next phase of our national healthcare progress. In the spirit of weaving strengths, the Maldives reaffirms its dedication to a system-wide approach through sustainable investments and international collaboration. As a small island nation vulnerable to climate change, we emphasize the need to research and development in building climate-resilient health systems that protect both patients and providers. Maldives earnestly seek partnership and technical expertise from leading nations to strengthen national capacity and implement impactful actions. Guided by the shared vision of the Manila Charter, we stand ready to contribute meaningfully to this collective mission. The Maldives fully endorses and stands firm its commitment to the summit declaration. I thank you all. Special thanks to all those people who supported me during this 3 days visit, especially my liaison officer, security, and driver. Thank you all. Wish you a safe and healthier life ahead. Thank you very much. Wassalamu alaikum.
Next, we have the Minister of Health of the Independent State of Papua New Guinea.
Good afternoon. The Secretary of the Department of Health, Dr. Hebosa, the Regional Director of WHO Western Pacific Region, Dr. Pierre Kala. I acknowledge the ADB Director of Health, Dr. Dodo Benson, Chair, Excellencies, distinguished delegates. Papua New Guinea is honored to participate in this important summit, reaffirming our strong commitment to patient safety as a fundamental pillar of our national health agenda. Safe and high-quality healthcare that is essential to achieving universal health coverage, and we continue to take decisive steps to strengthen our healthcare systems. To ensure strong governance and accountability in the healthcare, the national government has established a parliamentary committee on health, which provides oversight on all health matters, including patient safety. This reinforces our commitment to strengthening policies and initiatives that promote safer and high-quality healthcare for all our citizens. To institutionalize patient safety, Papua New Guinea has developed the National Health Standards 2021 and 2030, setting mandatory requirements for all stakeholders in the health service delivery. These standards mandates all provincial health authorities and the National Referral Hospital to undergo a compulsory 4-year National Health Accreditation Program to improve healthcare quality and ensure the delineation of manpower requirements across all levels of health facilities. Additionally, we have implemented the National Infection Prevention and Control Policy, which plays a crucial role in safeguarding both patients and health workers from preventable infections. The passing of the Cancer Radiation Law and its subsequent regulations also have enabled Papua New Guinea compliance with International Atomic Energy Agency membership under the Vienna Convention on Civil Liability for Nuclear Damage, ensuring radiation safety for both patients and caregivers. Recognizing the impact of climate change, the healthcare delivery, we are working with Asia Development Bank to develop climate-resilient primary health infrastructure, ensuring our health facilities remain sustainable and effective in the face of environmental challenges. Papua New Guinea stands fully committed to supporting the Mori-Long Declaration, which aligns with our national vision for a resilient, people-centered healthcare system. We remain committed to integrating patient safety and principles into national health policies, strengthening medication safety and ensuring community engagement to prevent medical errors. We urge all member states to collaborate in advancing patient safety, fostering knowledge exchange, and mobilizing resources to strengthen health system worldwide in line with the Global Patient Safety Action Plan 2021 to 2030. Together, let us ensure patient safety remains the core of the health care, protecting lives and upholding the highest standards of care for all. I want to take this time on behalf of my government to thank the organizers of this important program, especially to our protocol team and liaison officers who made this trip, this particular stay in the last few days in Chapel 1. Thank you to the government of the Philippines for showing the lead, taking the lead in patient safety and accommodating us for this important program. Thank you.
Now let's hear it from the Minister of Health and Social Welfare of Tuvalu.
Excellencies, distinguished delegates, and colleagues, the government of Tuvalu is committed to stronger health care, better patient safety, and equal access to medical care for all. But as a frontline nation facing climate change, we see more diseases, food and water insecurity, and extreme weather affecting health and patient safety. Our response is to build climate-resilient healthcare. The key initiatives, policies, and partnerships that follow global best practices. One of our most impactful programs is the Community and NCD Workers Initiative, which has significantly improved our early detection, referrals, and follow-up care for non-communicable diseases, NCDs. This initiative has successfully re-engaged patients who were previously lost to follow-up, increased clinic visits, and strengthen community-based healthcare, ensuring that no one is left behind in the fight against NCDs. To improve medical care, the government has committed to securing a full-time surgeon at our only Princess Margaret Hospital. This ensures better emergency and elective surgery despite our challenges. We have also started clinical audits to check patients' safety and improve healthcare quality. Our partnership with the World Bank, the Tuvalu Family Health Association, and ADB have made a big impact. The World Bank helped improve hospital and digital healthcare for remote areas. With the Tuvalu Family Health Association support, Tuvalu became the first Pacific nation to meet WHO cervical cancer screening target. ADB funding for HPV vaccines has exceeded WHO's recommended coverage, helping protect future generations. With WHO support, we continue to use standard treatment guidelines for diseases common to our country, such as diabetes and cardiovascular diseases, to ensure high-quality medical care. In the outer islands, there are not enough midwives, so we now transfer all pregnant women to Princess Margaret Hospital for safe delivery. This policy has resulted in zero maternal deaths in 2 years, meeting SDG targets. Expanding digital health, with World Bank funding, we have purchased Starlink satellite kits for outer island clinics, the primary healthcare level. This will improve telemedicine, patients' referral, and emergency care in remote areas. Tuvalu is dedicated to stronger healthcare, skilled workers despite shortage, safer hospitals, and digital health solutions. With continued partnership and good policies, we will build a resilient, inclusive, and high-quality healthcare system for all. In conclusion, I cannot just live without acknowledging many people. And on behalf of me and my delegation, I thank the host of this summit, Dr. Bosa and your team for organizing this summit, WHO for facilitating my visit to this summit, and particularly the liaison officers, security officers, the driver, and the caterers. And not forgetting the MC, who has facilitated this summit. We love you all, and thank you very much.
Thank you to our health ministers. Let's now move on to the deputy and vice ministers, starting off with Deputy Minister of Health of Zimbabwe.
Thank you. Good afternoon to everyone. Let me just write on the already observed protocol. Without doing any further, let me pass my special thanks to the organizers of this event, summit, to the ministers, the deputy ministers of health, and all delegates who have graced this event. I want to thank you. This from the bottom of my heart, and the country of beautiful country Zimbabwe, which is in southern Africa, beautified by flora and fauna, which I believe each and everyone in here at one day will be also in that country to witness the beauties in that country. As the Deputy Minister of Health and Child Care of Zimbabwe, I can concur that this summit has provided the much needed practical way of addressing most of the challenges we face in our country. Zimbabwe is a black African country which is in the southern Africa, also mostly relying on the domestic funding, especially on promoting health safety, patient safety, after it has been imposed on sanctions in 2000. Of which it's to the people who understand sanctions that it means it's difficult to survive without others, but Zimbabwe is trying to do mostly, especially on these safety issues. As a low to medium income country, our challenges to patient safety are similar to those presented during this summit. We see value in addressing these issues of patient safety in the context of our environment and community. We endeavor to provide for a culture of patient safety through improved quality health care that provides for improved infrastructure, resources, diagnostic services. We are committed to improved data capturing, sharing, and protection with subsequent analysis to ensure patient safety. The human resources for health remains a big challenge in my country due to migration for the greener pastures to these developed countries such as United States of America, United Kingdom, Canada, Ireland, to mention a few. But as a country, we've come up with the strategies to make sure that there is continuity of patient safety by introducing a strategy which is going to double the health workforce by 2030. Also, we've come up with the strategy to separate politics and health issues. The moment we keep on having these two issues not separated, there is no maintenance of patient safety. Nevertheless, there are lessons learned which were done in here that the patient safety can only be realized if the care providers have an inner drive, committed attitude, and a good will to improve patient experiences. Patient safety needs every cadre across the ministry to be on board, from security guards, cleaners, caregivers, to the highest office in the country. We have realized how other countries are leveraging artificial intelligence to advance care and patient safety. We will reach out to understand how we can be assisted so we don't lag far behind.
While we have the policy and strategy to implement agreed Global Patient Safety Action Plan 2021-2030, we have realized we need to revisit and strengthen patient representatives to advocate for better care. Error reporting is crucial in ensuring patient safety. The ministry will look into policy formulation based on no shame and no blame philosophies to encourage feedback on patient safety. As the ministry responsible for health care of the country, we reaffirm our commitment to advancing patient safety. I think we should also be given the opportunity to share our experience, especially from the low and medium income countries. We feel patient safety is global issue and this summit should continue to make it a global commitment worth implementing. I thank you.
Next, let's hear from the Secretary of State of the Republic of Angola.
Excelentísimo señor secretario de la Salud del Departamento de Salud de Filipinas, doctor Teodoro Herbosa, honorable director regional de la Oficina de la OMS para el Pacífico, doctor Saya Piocala, distinguidos ministros de la Salud y secretarios de Estado de los Estados miembros de la OMS, distinguidos delegados, mis señoras y señores. Deseo expresar nuestra gratitud en nombre de la delegación de Angola por la invitación que se ha extendido para nuestro país, por la calurosa recepción que hemos tenido aquí en Filipinas. Traigo saludos de Su Excelencia Ministra de la Salud de Angola, doctora Silvia Paula Valentín Lutucuta. Excelencias, señoras y señores, Angola ha implementado buenas prácticas de la seguridad del paciente. En nuestra unidad de salud hemos reforzado el compromiso con la mejoría de la calidad en la atención de los pacientes y hemos avanzado a partir del Chile, donde participamos en la cimera pasada, con acciones de capacitación de nuestros profesionales, seguimiento, supervisión, así como aspectos fundamentales de la seguridad del paciente en la prevención de quedas, la comunicación efectiva entre profesionales, la mejoría en la prescripción de medicamentos, la seguridad quirúrgica, la higiene de las manos, así como otros aspectos fundamentales. Me gustaría seguir diciendo que en el ámbito de la regulación farmacéutica, Angola aprobó la creación de la Agencia Reguladora de Medicamentos y permite que los medicamentos sean seguros a nivel nacional, y pasamos para la regulación referente a las compras. Son compras agrupadas de medicamentos hechas por la Central de Compra a nivel nacional. En nuestros hospitales destacamos la legislación con la creación de comisiones hospitalares, como la de control de infecciones hospitalares, la Comisión de Farmacia y Normalización de Medicamentos, comisiones de auditoría clínica, y creamos en nuestros nuevos hospitales comités de calidad y certificación de los servicios y de los hospitales. En los últimos 5 años, Angola ha ampliado su red sanitaria con la construcción de más de 190 unidades de salud de gran porte, entre ellas 13 de nivel nacional de alta calidad, y hemos aumentado el número de camas de 13.000 para 39.000 en los últimos 7 años. En estas unidades se ofrece servicios de alta calidad. Como dijimos, estamos digitalizando los procesos asistenciales para evitar fallas humanas, y en estos hospitales realizamos procedimientos quirúrgicos, neuroquirúrgicos, la atención materno-infantil, y tenemos un programa de implementación de cirugía robótica a nivel nacional, y en este momento estamos realizando cirugía robótica en la capital. La formación de recursos humanos es un desafío para todos. Estamos formando 38.000 profesionales con el apoyo de un financiamiento del Banco Mundial, formando médicos, enfermeros, técnicos de diagnóstico, con énfasis en los enfermeros y en los cuidados primarios de salud para cuestiones referentes a la seguridad del paciente. Estamos implementando, divulgando el Plan Nacional de Seguridad del Paciente y el Plan de Control de Infecciones discutido en 2024 se encuentra en fase de implementación. Me gustaría en nombre de Angola, más una vez, en este evento, reforzar nuestro compromiso con las mejoras continuas basadas en la declaración de Mandaluyong y en nombre de Angola, más una vez, agradecer a la comisión organizadora y al país que cedía este evento, que es Filipinas. Muchas gracias en nombre de Excelencia Señora Ministra de la Salud, doctora Silvia Paula Valentín Lutuguta. Gracias de corazón a Filipinas. Muchas gracias.
Next is the Secretary of State of the Kingdom of Cambodia.
Jumrip Su, Excellency Chair, Excellency Regional Director, Honorable Health Minister, Vice Ministers, distinguished colleagues, experts, ladies and gentlemen. First of all, I would like to express our sincere thanks for this invitation. Please accept the friendship and regards from the people of the Kingdom of Cambodia. On behalf of His Excellency Professor Chiang Rai, the Health Minister of Cambodia, I am honored to join you at this very special 7th Global Ministerial Summit on Patient Safety, same waving strength for the future of patient safety throughout the healthcare continuum. Our collective mission to create safer healthcare environments relies on the sharing of knowledge and best practices. Cambodia is committed to enhancing patient care through dynamic collaboration with both international and national partners. The Global Patient Safety Action Plan 2021 and 2030 through this 7th Global Ministerial Summit outlines strategies to improve patient safety. We focus on continuous improvement and collaboration to reduce medical incidents. As patient care grows more complex, driven by new technology and therapeutic approaches, ensuring patient safety is fundamental and requires involvement from all stakeholders with well-defined responsibilities. In line with the Global Action Plan, Cambodia has implemented key measures. First, the roadmap of Cambodia toward universal health coverage 2024-2035 ensure that quality and safety are a priority in health service delivery for all citizens. Second, the Cambodian hospital accreditation standards are actively enforced across public health facilities, promoting a blame-free culture for incident reporting. Third, minimum standard licensing for private healthcare facility is closely monitored with the focus on best practices for patient safety. Fourth, health professional council collaborate with various stakeholders to ensure comprehensive patient safety. This initiative underscore our commitment to improving patient safety, thereby contributing to a resilient healthcare system. We continue to collaborate with all our esteemed partners to minimize avoidable harm while achieving universal health coverage outcome. Thank you for the wonderful hospitality and wonderful organization. Som Okun.
Now let's hear it from the Assistant Minister of Health of the Republic of Fiji.
The theme for this summit is weaving strength for the future of patient safety. For me, it is indeed timely and appropriate for all participants of this two-day summit. The chair of the forum, distinguished delegates, excellencies, the secretary of the Department of Health for Philippines, the Regional Director, WHO, Dr. Isaiah Pucala. Excellencies, Ministers and Assistant Ministers, ladies and gentlemen, Bulabinaka and greetings to you all. On the outset, I must thank ADB and WHO for organizing this summit, and also thank the Department of Health for the Republic of Philippines, and for your people for looking after us so well. For those of you that do not know Fiji, Google told me it's 10,000 kilometers away from here. It's about almost 20 hours flight. And we thank the hospitality that was rendered to our team during our stay here in Manila. Google also told me that the citizens of Philippines do not need a visa to come to Fiji. Please do come over. Fiji's commitment to patient safety, we remain committed to the Global Patient Safety Action Plan 2021 to 2030, which has a vision, a world in which no one is harmed in healthcare, and every patient receives safe and respectful care every time, everywhere. Our historical context of clinical governance, Fiji's approach to patient safety is encapsulated in the clinical governance approach, which dated back to 2005 when it was introduced into the ministry through its risk management policy and framework, which has been revised twice, once in 2019 and also in 2021 respectively. On our clinical implementation and improvement, over the years, Fiji has implemented and strengthened its clinical governance program through strengthened infection control, prevention, and protocol to reduce healthcare-associated infections. Mandatory patient safety training for healthcare workers at all levels, strengthening of clinical audit and mortality review to track and improve patients' outcome, enhancement of medication safety program to prevent adverse drug events. Also strengthen its incident reporting and root cause analysis process through its digitalized reporting system. On our established clinical service network and quality improvement, Fiji since 2008, Clinical Service Network or CSN has been established for the clinical discipline in the ministry and implemented quality improvement projects such as Between the Flags, a program identifying early clinical signs or deterioration of clinical status among our admitted patients that initiates the necessary and appropriate response early to arrest further deterioration of our service. On our strengthened national clinical governance, for national oversight, the National Clinical Governance Committee has also been strengthened, meeting quarterly to monitor implementation of clinical governance operational plan at its health facilities. On the future strategies for patient safety enhancement, in moving forward, Fiji is focused on strategies for strengthening patient safety through enhancing regulations and standards aligned with Global Patient Safety Action Plan recommendation, also expanding training program for healthcare workers on patient safety protocols. Also, this afternoon, we're taking on board the declaration from this summit. On our crisis preparedness, we are strengthening emergency preparedness and response system to sustain patient safety during crisis, and in particular in the Pacific Ocean, the climate crisis. Patient-centered care encourages a patient-centered approach where individual patients actively participate in their care. For funding and collaboration, we try to secure sustainable funding for patient safety program, workforce workforce training, and also safety infrastructure, and foster partnership with regional and global stakeholders to drive innovation in safety practices. I thank you for your attention, and I thank the chair for giving me the floor to deliberate this afternoon. Thank you very much.
Next, we have the Deputy Minister of Health of Georgia.
Excellencies, ministers, distinguished colleagues, it's a privilege for me to join you today to reaffirm Georgia's commitment to patient safety and to show progress in implementing the Global Action Plan 2021-2030. In today's global context, this issue is more relevant than ever, and ensuring safe and accessible healthcare remains a common challenge for all nations. In 2023, the government of Georgia established a National Safety Council, reflecting the high political priority placed on ensuring the safety of patients. This multi-sectoral body includes representatives from government institutions, academia, healthcare associations, international organizations, and public defender of Georgia. In the same year, the Ministry of Health introduced the National Patient Safety Program, fully aligned with WHO's Global Action Plan. This program outlines strategic priorities and incorporates international best practices to strengthen safety across the health system. A range of initiatives are already underway, introducing international accreditation standards for hospitals, enacting the regulatory environment for licensing and permits, rolling out patient pathways for chronic disease management, and implementing a national strategy to combat antimicrobial resistance. Importantly, the Ministry of Health has elaborated the Climate Change Adoption Plan in health sector, which will be approved soon. This plan ensures that climate change-related risks are fully integrated into patient safety policies and planning. We recognize that advancing patient safety requires a fundamental shift from a culture to blame to system-based thinking, allowing us to understand and address the root causes of harm. Looking ahead, one of our key priorities is to establish a national definition of medical error and to develop robust systems for investigating and analyzing medical errors and patient right violations. This will support evidence-based recommendations to prevent harm and foster learning. Georgia remains fully committed to international collaboration and to building a healthcare system where patient safety is not only a goal, but reality for all. Thank you very much. And thank you for your hospitality.
Let's hear it this time from the Deputy Minister of Health of Indonesia.
Honorable Secretary of Health, Department of Health Philippines, all Minister and Deputy Minister of Health from all countries, Regional Director WHO Western Pacific Regional Office, Representative Director of ADB, all delegates, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon. Mangandang hapon sa inyong lahat. Selamat siang. Seatbelts are not just a law. They are a lifeline. Just like our habit to put the seatbelt on for safety when driving. We need to have the same level awareness for patient safety. Indonesia, through Astacita or 8th aspiration, at the core of the President Prabowo's leadership, priorities health as a fundamental concern. Patient safety is among our priority in a national healthcare policy, as outlined in our national strategy for patient safety, which aims to improve healthcare quality through risk management. To put this into action, Indonesia established the National Committee for Patient Safety, requiring all healthcare facilities to have a patient safety committee or team as a part of their healthcare services. We are committed to strengthening leadership and training healthcare workers to build a strong patient safety culture. We also promote safety awareness through surveys and education in medical institutions. To ensure transparency, Indonesia used an IT-based system for reporting patient safety incidents, directly linked to the Ministry of Health. We also provide quarterly learning feedback to prevent similar cases and award provinces and facilities that report regularly on time. Indonesia healthcare facilities have taken significant steps to integrate patient safety into disaster preparedness and climate resilience. Hospitals have developed policies and guidelines to ensure the healthcare facilities are equipped to maintain patient safety during emergency, including natural disaster and climate-related crises. In primary healthcare centers are trained to provide emergency response services, coordinate with local disaster management agencies, and ensure the continuity of essential healthcare servicing during crisis. Excellency, ladies and gentlemen, despite progress, we understand that challenges remain. In this regard, on behalf of the government of Indonesia, we would like to express sincere gratitude and congratulations to the government of Philippines and IDB for the successful organizing of this important summit to reaffirm our commitment to patient safety, including through the adoption of the Mandaluyong Declaration. We call for continued global collaboration to exchange the knowledge, share expertise, and improve patient safety through innovation and technology. To conclude, let's fasten our seatbelt to make patient safety our culture. Thank you, salam apo, dan terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Next is the Vice Minister of Health of Japan.
Thank you. And first of all, I'd like to extend my sincere gratitude to the Department of Health of Philippines Secretary Dr. Herbosa and his team for hosting this excellent summit, and thank all the participants gathering here. Recognizing uncertainty of the current situation in global economy and global health, we must continuously keep in mind that patient safety is one of the top priorities in healthcare policy. Now, having said that, Japan maintains through legal frameworks and open communication with the general public its deliberate focus on patient safety momentum at multiple levels, from the clinical front line to political decision making. Despite such uncertainty I mentioned, the goal of patient safety to protect every individual, including the vulnerable, from avoidable harm remains the universal value. I strongly believe it has been extremely meaningful to reaffirm this solid value during this summit. In order to maintain this momentum for patient safety, let us pledge that each country's leaders gathered here today will promote strong measures in our respective nations and collaborate beyond every kind of boundaries in united efforts to enhance patient safety. Thank you for your attention.
Next, we have the Vice Minister of Health of Panama.
Muy buenas tardes a todos. Doctor Teodoro Herbosa, secretario de Salud de Filipinas, doctor Eduardo Benson, director de la ADB.
Good afternoon, everyone. Good afternoon.
Venimos de Panamá, Centroamérica, América Central. Estimados colegas y participantes, es un honor para mí dirigirme a ustedes en esta cumbre ministerial de seguridad del paciente. Un espacio de reflexión y acción para construir un futuro más seguro del paciente y equitativo en la atención de salud global. El lema de esta cumbre, tejiendo fortalezas por el futuro de la seguridad del paciente a través de la atención de salud continua, refleja el compromiso conjunto de todos los sectores involucrados en la salud, desde los gobiernos hasta los proveedores de atención, los pacientes y las comunidades aquí representadas. La seguridad del paciente no es solo una prioridad, es la base sobre la cual podemos asegurar que cada intervención médica, cada tratamiento, cada cuidado prestado sea hecho con la máxima confianza y en el mejor interés de quienes más lo necesitan. A medida que avanzamos hacia un futuro lleno de desafíos, avances en tecnología y prácticas clínicas, debemos recordar que la seguridad del paciente es un derecho fundamental y protegerla es una responsabilidad compartida que debemos garantizar. Tejer fortalezas implica fortalecer nuestras políticas, procedimientos, educación y lo más importante, nuestra colaboración. Solo mediante un esfuerzo continuo y colectivo podremos asegurar que cada paciente reciba la atención más segura, efectiva, sin importar dónde se encuentre ni las circunstancias que enfrente. La seguridad del paciente no es un objetivo estático, sino un proceso en constante evolución que implica una vigilancia constante y una mejora continua de la calidad, donde cada miembro del equipo de salud, desde el ministerio hasta el personal de primera línea, desempeña un rol esencial. Hoy, en Manila, nos reunimos no solo para compartir conocimientos, sino para comprometer nuestros esfuerzos y mejorar la seguridad de nuestros sistemas de salud. El futuro de la seguridad del paciente depende de lo que hagamos hoy, juntos con un propósito común, el paciente. Gracias a todos por su dedicación y compromiso. Sigamos tejiendo estas fortalezas paso a paso hasta lograr una atención de salud más segura, más eficiente y humana para todos. Muchas gracias.
So, dear colleagues and participants, it is an honor for me to address you at this Ministerial Summit on Patient Safety, a space for reflection and action to build a safer and more equitable future in global health care. The theme of the summit, Weaving Strengths for the Future of Patient Safety Across the Continuum of Care, reflects the joint commitment of all sectors involved in health, from governments to care providers, patients, and the communities present here. Patient safety is not just a priority, it is the basis on which we can ensure that every medical intervention, every treatment, and every care provided is done with the utmost confidence and in the best interest of those who need it most. As we move towards a future full of challenges and advances in technology and clinical practices, we must remember that patient safety is a fundamental right, and practicing it is a shared responsibility that we must guarantee. Building strengths means strengthening our policies, procedures, education, and most importantly, our collaboration. Only through continuous and collective effort can we ensure that every patient receives the safest and most effective care, no matter where they are or the circumstances they face. Patient safety is not a static objective, but a constantly evolving process that involves constant vigilance and continuous quality improvement, where each member of the healthcare team, from the ministry to the frontline staff, plays an essential role. Today in Manila, we are meeting not only to share knowledge, but to commit our efforts to improving the safety of our health systems. The future of patient safety depends on what we do today, together, with a common purpose. Thank you all for your dedication and commitment. Let us continue to build on these strengths step by step until we achieve safer, more efficient, and more human healthcare for all. Thank you very much.
Next is the Deputy Minister of Health of the Russian Federation.
Дорогие коллеги, дорогие друзья, участники саммита.
Dear colleagues, dear friends, dear participants of the summit.
Безопасность пациентов – ключевой приоритет качественного здравоохранения. Россия, следуя резолюции Всемирной ассамблеи здравоохранения и глобальному плану действий, системно внедряет принципы безопасности на всех уровнях медицинской помощи.
Patient safety is a key priority for quality healthcare. Russia, following the World Health Assembly resolution and the global plan of action, is systematically implementing safety principles at all levels of care.
Создание эффективной, пациентоцентричной и безопасной системы здравоохранения – ключевой приоритет России. Для этого в стране реализуется комплекс системных мер.
Creating an effective, patient-centered, and safe healthcare system is a key priority for Russia. To achieve this, the country is implementing a set of systematic measures.
В первую очередь, это обеспечение населения качественными и безопасными лекарственными препаратами и медицинскими изделиями.
First of all, it is to provide the population with quality and safe medicines and medical devices.
В нашей стране внедрена эффективная система фармаконадзора, соблюдаем надлежащие фармацевтические практики.
Our country has introduced an advanced system of pharmacovigilance, and we observe good pharmaceutical practices.
С 2020 года мы применяем обязательную маркировку для мониторинга всего жизненного пути лекарственных препаратов, планомерно внедряем маркировку медицинских изделий.
Since 2020, we have been applying mandatory labeling to monitor the entire life cycle of medicines, and we're systematically introducing labeling of medical devices.
Осуществляется непрерывный сбор и анализ извещений о нежелательных реакциях и событиях при применении лекарственных препаратов и медицинских изделий.
We continuously collect and analyze notifications from about adverse reactions and events during the use of medicines, products, and medical devices.
Уделяем особое внимание оказанию качественной медицинской помощи на основе национальных клинических рекомендаций, разработанных профессиональным сообществом с опорой на глобальный опыт, обязательной частью которых являются критерии оценки качества оказания медицинской помощи.
We pay special attention to the provision of quality medical care on the basis of national clinical guidelines developed by the professional community, with reference to global experience, of which quality criteria for medical care are an obligatory part.
В В России работает трехуровневая система мониторинга контроля качества оказания медицинской помощи, разработаны рекомендации по системе менеджмента качества. Благодаря принятым на сегодняшний день мерам за 5 лет удалось в более чем 500 медицинских организаций на треть уменьшить, на треть повысить уровень безопасности для пациентов.
Russia has a 3-tier quality monitoring system in place. Thanks to the measures taken, the level of safety has increased by 1/3 in more than 500 medical organizations over 5 years.
Оперативный сбор информации со всей территории страны и своевременное принятие управленческих решений реализуется посредством цифровых технологий, направленных как на повышение доступности медицинской помощи, так и на упрощение взаимодействия между медицинскими организациями.
A prompt collection of information from across the Russian Federation and timely management decision-making are implemented through digital technologies aimed at both improving access to medical care and simplifying interaction between medical organizations.
Во время пандемии COVID-19 мы внедрили национальный регистр больных, который позволял в режиме реального времени получать информацию о состоянии здоровья пациентов, обеспечивать доступность и качественную медицинскую помощь в условиях перегрузки системы здравоохранения. Используем этот опыт и в новых проектах.
During the COVID-19 pandemic, we implemented the National Patient Register, which allowed us to receive real-time data on patients and ensure the availability and quality of medical care in conditions of system overload. We're also using this experience in other new projects.
Наращивается и кадровый потенциал, постоянно повышается квалификация медицинских работников, в том числе для работы в прогрессивных областях, таких как медицинская кибернетика, робототехника, VR-технологии, технологии с применением искусственного интеллекта.
We are also building up our human resource potential by constantly upgrading the qualifications of medical workers, including for work in progressive areas such as medical cybernetics, robotics, VR technologies, and artificial intelligence technologies.
Уважаемые коллеги, вот уже в 7-й раз мы встречаемся, подтверждая нашу приверженность безопасности пациентов. Уверен, что этот саммит и итоговая декларация укрепят глобальную осведомленность и объединят международные усилия для снижения рисков и повышения безопасности пациентов во всем мире.
Dear colleagues, this is the 7th time we meet, reaffirming our commitment to patient safety. I am confident that this summit and the final declaration will strengthen global awareness and unite international efforts to reduce risks and improve patient safety worldwide.
И в конце хотел бы поблагодарить доктора Эрбоза и всю его команду Министерства здравоохранения Филиппин за возможность принять участие в этом саммите, а также за возможность посещения медицинских организаций Филиппин, чтобы посмотреть, как это работает непосредственно на месте.
And also I would like to thank you, dear Secretary Herbosa and his team, Department of Health. Thank you for allowing us to participate in this summit, and also I would like to express my gratitude for giving us opportunity to visit the healthcare facilities.
Thank you very much.
Next, we have the Vice Minister of Health of Timor-Leste.
From Russia, we come back to the Asia and Pacific. Exactly between Asia and Pacific, we have a small island countries called Country of Sunrise, Timor-Leste. Timor-Leste is located between Asia and Pacific. I'm glad to be here. First time attending the Global Ministerial Summit on Patient Safety. Thank you for the invitation, Dr. Theodore Barbosa and Dr. Saya, Regional Pacific Director. Distinguished ministers, experts, and delegates. As a new country, within 20 years of our independence, we continue to develop our policy and intervention related patient safety. We able in policy level, we able to integrate patient safety in our national strategic plan 2025 to 2030. In interventional level, Timor-Leste continue engage and adapt best practice in their clinical services and continue introducing reporting system in all level of care and continue use the tools recommended by professional entities. Despite all the policy and intervention that we achieve, we still face our challenges. As a small country, we share experience, we still lack of professional or dedicated person to do the great job. We still lack of financial protection. We still lack of human resources that we all get the information and sharing into today's our submit. For this time, Timor-Leste considers 7 ministerial meetings as a wake-up call to health providers and services to adapt new strategic objective in promoting patient safety. It is time to put our effort into action by sharing responsibility, synergism, our action, and support in the area of policy and intervention in patient safety. I thank you very much.
I'd like to thank the Deputy and Vice Ministers. Now we invite to the podium the Ambassador of the Slovak Republic.
Excellencies, ladies and gentlemen, let me also extend my gratitude to the government of Philippines, to the Department of Health and to the Asia Development Bank for hosting this important event today and yesterday. Patient safety should represent one of the highest priorities in the healthcare systems around the world. In line with the international efforts to enhance patient safety within the framework established by the WHO, Slovakia is actively implementing the principles and objectives outlined in the Global Plan for Patient Safety for 2021 and 2030 at the national level. For more than a decade, the Slovak Republic has actively sought to enhance awareness of patient safety among healthcare professionals while diligently identifying the most common causes of incidents that may pose risks to patients. In this context, a wide range of projects and programs have been developed. Particular attention is given to primary pediatrics, nuclear medicine, cancer screening, diagnostic and treatment, which is viewed as a crucial component along with the efforts focused on the optimization of the outpatient and hospital practices. Slovakia actively participates in numerous international initiatives and projects aimed at enhancing patient safety and facilitating the exchange of best practices. These research projects are integrated into WHO initiatives, providing a platform for countries to share their experiences and support global cooperation. Ensuring patient safety means a continuous process that demands well-tailored policies, evolving evidence-informed clinical guidelines and recommendations, as well as institutionalization of clinical audits alongside targeted, coordinated actions. These actions are essential in securing that every patient receives care that meets the highest possible standards. In conclusion, it is imperative that we continue to nurture international cooperation, knowledge translation, and mobilization to advance high quality and safe healthcare for all individuals worldwide. We must collectively strive at the global level to make sure that every person has access to safe and quality healthcare services. Thank you for your attention.
Now we move to the heads of delegation, starting off with the Republic of Benin.
Permettez-moi d'exprimer ma gratitude au ministre de la Santé des Philippines et toute son équipe pour tout ce qui a été fait. Le message que je vais vous délivrer sera fait en anglais et il est au nom du ministre de la Santé du Bénin. The Head of State, His Excellency, Mr. Patrice Talon, and the government of the Republic of Benin have made patient safety a priority of the healthcare ecosystem. That is why, alongside the construction of new high-performance healthcare facilities, others are being renovated, some are better equipped, and a large number of healthcare professionals are being recruited. Since March 28, 2024, a patient safety mechanism has been deployed and implemented on a large scale of all healthcare facilities, whether public or private. The Republic of Benin remains open to all collaboration that contribute to achieving its goal of eliminating preventive harm more efficiently and effectively. Digital health plays a key role in his efforts. Thank you for your attention.
Next, we have Brunei Darussalam.
Honorable Secretary of Health, the Republic of the Philippines, Dr. Herbosa, Excellency, Honorable Ministers, Deputy Ministers, distinguished guests, ladies and gentlemen. Good afternoon, magandang hapon. Firstly, on behalf of the Honorable Minister of Health, Brunei Darussalam, I would like to take this opportunity to congratulate the Republic of the Philippines, Department of Health, and the ASEAN Development Bank for a successful and insightful summit on patient safety. Patient safety is a cornerstone of healthcare, but also a critical driver of health system performance. Millions of patients suffer harm due to preventable errors such as medication errors, surgical complications, misdiagnosis, just to name a few. These incidents are systemic failures reflecting gaps in policies, infrastructure, and governance. So Brunei Darussalam has long recognized the importance of patient safety. Our healthcare system is built on the principles of quality, accessibility, and equity. Patient safety has been prioritized as a strategic goal as reflected in the Ministry of Health's strategic plan document. This commitment is evident in several key initiatives, among others. One of them is strengthening leadership capacity through training and collaboration with countries, thus empowering our healthcare managers to become champions of patient safety. Nurturing safety culture awareness by incorporating into academic, professional training, and continuous professional development programs at all levels. Conducting regular training and educational sessions by the quality and safety units of each facility under the ministry to ensure that safety remains a core value at every level of our healthcare system. Brunei Darussalam are also cognizant that engagement with staff at all levels is crucial in inculcating patient safety culture, and hence the ministry has conducted town hall sharing sessions as well as continuously monitoring the status through safety
culture surveys in all healthcare facilities. We also acknowledge that good and meaningful data is the backbone of an effective policy. And with this in mind, an online incident reporting system was developed, which provides valuable information on adverse events to identify patterns and root causes, actions to be taken to address the gaps, as well as serve as a guidance for our healthcare strategies. Environmental sustainability within the healthcare sector is another emerging issue, which is inextricably linked to patient safety. And towards this, the Climate, Health and Sustainability Task Force has been established to lead this initiative, aligning with global best practices and WHO's guidelines. The task force facilitates the integration of sustainable practices into all aspects of healthcare delivery, education and policy making, fostering innovation, collaboration to reduce environmental impact and enhance the health and well-being of our population. To achieve this, a whole-of-government approach was adopted with regional and international collaboration to strengthen coordination and capacity on preparedness and response, including public health emergencies and disasters. These initiatives are critical in ensuring that Brunei's healthcare system remains resilient and sustainable. Another important milestone is riding on the advances of digitalization in healthcare with the introduction of Bru Health, an application where all electronic health data and records from diagnostic equipment, including data analysis, are driven and integrated with artificial intelligence to improve diagnostic accuracy. This will ensure that every diagnosis made is correct and accurate. At the same time, with close collaboration with all relevant stakeholders, will improve the disease diagnostic process by enhancing communication. This integrated and collaborative effort can help reduce errors and prevent diagnosis delays, as well as achieve a safe and effective healthcare system. As we continue our journey in progressing patient safety, Brunei Darussalam will continue the following: develop and refine our policies and strengthen the framework for safer care in alignment with WHO Global Safety Action Plan 2021-2030, promoting and continuous monitoring of patient safety goals in all health facilities, ensure compliance with international standards through international accreditation, strengthening accreditation and regulation to the quality and safety of our healthcare system, assure universal health coverage, ensure accessibility and equitable healthcare to all through provision of comprehensive primary healthcare services, empower and engage patients and families, patient safety as an empirical part in designing healthcare facilities and medical equipment management. Ladies and gentlemen, let us remind ourselves that patient safety is not a luxury. It is a right. It is the foundation of trust in all healthcare system and an integral part of universal health coverage. With this Mandaluyong Declaration on Patient Safety, Brunei Darussalam supports the recommendations in addressing and will continuously support this effort in improving safety in healthcare. Lastly, on behalf of the Honorable Minister of Health, Brunei Darussalam, we would like to congratulate the Republic of Philippines, the Department of Health, ASEAN Development Bank, and all the organizing committee for this successful event. Thank you. Salamat po.
Next is Republic of Chile.
Dear Excellencies, delegates, ladies and gentlemen, colleagues, friends, Chile thanks the Philippines for its commitment and leadership in ensuring people's safety in a healthcare context. Last year, we called for concrete actions, especially in terms of implementing and sustaining intervention at the national and subnational levels. We know that we have a long way to go. The global context at times conspires with a long-term view, but we understand that by strengthening public policies and governance frameworks, we are contributing to a better future. Chile has made this task a priority and will shortly publish the National Patient Safety Plan, which will make it possible to recognize, align, and coordinate all the efforts and progress that already were there. We celebrate the declaration intention. They align with our priorities. We firmly believe in international cooperation as a path to development. The inspiring principles of the Filipino tradition of bayanihan have become indispensable in the present times. We will continue to work to develop and implement evidence-based regulatory frameworks, prioritize investment in the workforce, and leverage advances in scientific and technology to reach all people everywhere. All of this always recognizing the imperative of involving patients and their families in decision makers as an integral part of public policy and daily clinical practice. Therefore, in continuity with the commitment made in Santiago Charter, we are happy to adhere to Mandaluyong Declaration. And Dr. Herbosa, all the organizer, Dr. Reynabel, Gabriel, Chica, thanks for your really hard work. Muchas gracias.
Next is Republic of Ireland.
Honourable Secretary for Health, Dr. Herbosa, Ministers and other esteemed guests, a greeting from Ireland. Gur magat as ocht an deis leat aniu agus an ochad tabatach agus shasab na hair na legan amach. So what that means is thank you for the opportunity to speak at this very important event and convey Ireland's position on patient safety. The Minister for Health in Ireland is committed to driving progress and best practice in quality and patient safety across the health service. With this aim in mind, the National Patient Safety Office, or NPSO, was established within the Ministry to provide leadership and policy direction. Current work streams include extending the National Clinical Effectiveness Framework, establishing a patient safety surveillance system, advancing health policy in relation to antimicrobial resistance, revising our framework for incident management, and continuing our work on clinical complaints policy, to name but a few initiatives. In keeping with the ethos of the Ministerial Summits, our national patient safety priorities align with the WHO's Global Patient Safety Action Plan. Ireland is committed to implementing the action plan and is working to integrate actions into the national patient safety and quality agenda. To further this goal and our overall commitment to advancing patient safety in Ireland, the NPSO works closely with our public healthcare provider, the Health Service Executive, or HSE. Amongst many collaborative patient safety initiatives, the HSE Patient Safety Strategy is a key policy document as it sets out the operational patient safety priorities for Ireland.
Good afternoon, everybody. To continue, from a legislative perspective, our Minister for Health in Ireland has initiated the Patient Safety, Notifiable Patient Safety Incidents and Open Disclosure Act of 2023. This act was signed into law by our President to further embed open disclosure in the Irish healthcare sector. Stemming from this act is a new national policy framework on open disclosure in the health and social care sector was published. An important part of today's event is the Mandaluyong Declaration on Patient Safety. We note its central tenets, which is strengthening global collaboration for patient safety, advancing leadership and governance in patient safety, integrating patient safety into disaster and emergency preparedness,
and climate resilience, and building a people-centered approach to patient safety. This aligns strongly with Ireland's patient safety principles and strategic objectives. For example, in line with the Declaration's commitment to building a people-centered approach to patient safety, in Ireland this 2025, our new program for government has committed to supporting and extending existing patient advocacy initiatives. These initiatives will support those availing of healthcare in Ireland. Ireland would therefore like to take this opportunity to endorse the Mandaluyong Declaration on Patient Safety. Finally, I would like to say our thank you in Filipino language. Nais po naming ipabot ang aming taus-pusong pasasalamat sa kalihim ng kagawaran ng kalusugan ng Pilipinas, Dr. Teodoro J. Herbosa, at sa kanyang mga staff sa pag-anyaya sa amin na dumalo at lumahok sa napakahalagang summit na ito. At sa kanilang mainit na pagtanggap, maraming salamat at magandang hapon po sa inyong lahat. Thank you and good afternoon to all.
Next is Republic of Kenya.
Good afternoon, everyone. Honorable Secretary of Health, Department of Health Philippines, Regional Director, the WHO Regional Office for the Western Pacific, esteemed ministers, deputy ministers, and distinguished guests. I read the statement for Kenya on behalf of the Principal Secretary, State Department for Public Health and Professional Standards, where the Patient Safety Unit is domiciled. Every year, millions of patients around the world suffer harm in the very systems meant to heal them. Unsafe care remains one of the top 10 causes of death and disability globally. The burden is heaviest in low and middle-income countries, where the risk of avoidable harm is greatest, yet solutions are within reach. Kenya stands in solidarity with the global community to address this challenge head-on. We fully support the global patient safety movement and reaffirm our commitment to building health systems where safety is not negotiable. As we advance universal health coverage, we recognize that it must be more than just access. It must guarantee safe and high-quality care for every person, everywhere. Our foundation as a country is strong. Kenya has made real progress in infection prevention and control and tackling antimicrobial resistance through our national IPC strategy, as well as our national AMR action plan. We are now expanding this work in a broader system wide patient safety agenda, which is aligned to the Global Patient Safety Action Plan 2021-2030. And this has been achieved through development and ongoing implementation of our national patient safety, health worker safety, and quality of care action plan. All these three programs being domiciled within the patient safety unit. We deeply appreciate the technical support and collaboration that we have received from the Global Patient Safety Collaborative, which continues to strengthen our national capacity and implementation of the patient safety agenda. We also commend the summit's focus, especially on patient engagement, climate-related risks, and strengthening safety at all levels of care. These are deeply relevant to our national strategy. Finally, Kenya proudly endorses the Mandaluyong Declaration on Patient Safety. We are committed to working together with all nations to eliminate avoidable harm and deliver safer care for all. On behalf of the government of Kenya, I wish to extend our sincere appreciation to the government of Philippines for planning and hosting the 7th Ministerial Summit on Patient Safety. We are especially grateful for the kind invitation extended to Kenya to participate in this important dialogue. Thank you all.
Next, we have State of Libya.
Good afternoon. Your Excellency, Ministers of Health, Your Excellency, the Minister of Health of Republic of the Philippines, ladies and gentlemen. First of all, I would like to thank the Republic of Philippines for their kind invitation and for hosting the 7th Global Ministerial Summit of the Patient Safety. This is the important global event that directly impacts the health and safety of healthcare professionals, patients, and their families. Improving the patient safety is vital for ensuring effective, reliable, and safe healthcare services. This goal is deeply connected to providing a safe environment and initiative world-class quality in healthcare. Achieving this requires continuous improvement in medical intervention, updating scientific guidelines, and refining medical practice to achieve the best possible outcomes for patients. Patient safety remains one of the highest priorities of healthcare, with the primary aim being the reduction of medical errors and ensuring patient safety during the treatment. This can be achieved by improving communication among the healthcare teams, fostering of culture, reporting errors, and advancing technological systems to better monitor patient conditions. The state of Libya has given significant attention to patient safety and its connection to enhancing the quality of healthcare services. As a part of commitment, patient safety program coordinator has been assigned to all healthcare facilities to oversee implementation of the policies, procedures, and directives issued by quality committees in these facilities, as well as to ensure the execution of all standards and initiatives provided by the Ministry of Health. Ladies and gentlemen, the Ministry of Health of the State of Libya remains committed to implementing the mandatory patient safety standards alongside achieving the 6 global goals for patient safety. In conclusion, I would like to extend my heartfelt thanks and appreciation to all of you and the Republic of Philippines for hosting this summit and providing us with the opportunity to engage in this important discussion. Thank you for attention.
Next, we have United Mexican States.
Distinguished Excellencies, delegates, and colleagues, on behalf of Dr. David Gersenovich, Minister of Health of Mexico, and myself, I want to say thank you to Dr. Teodoro Herbosa for your hospitality and such a wonderful summit, to you and your team. Mexico reaffirms its commitment to patient safety through its adherence to the Declaration of Mandaluyong, waving strengths for the future of patient safety throughout the healthcare continuum by strengthening global collaboration for patient safety, advance leadership and governance in patient safety, integrate patient safety into disaster preparedness and climate resilience, and building people-centered approach to patient safety. Mexico has been working on patient safety strategies since 2002, starting with sensitization, measuring the problem in the country, putting in place mandatory essential actions for patient safety, and now building initiatives to have a smart health system that learns through its mistakes. All these initiatives have been implemented in collaboration with actors and stakeholders in Mexico's healthcare system, along with international organizations such as WHO, PAHO, IHI, GICI, and ISQA. We are committed to continue developing and innovating in order to contribute to have safer health systems. Thank you.
Next is Republic of Malta.
Excellencies, distinguished colleagues, and esteemed guests, first of all, I would like to convey my deep appreciation on behalf of the Ministry of Health and Active Aging in Malta for the wonderful summit that the people of Philippines have given us, and the great friendships and collaborations that came out from the different social events and the different meetings. Thank you. I'm honored to represent the Maltese Minister for Health and Active Aging at this pivotal summit on patient safety. Malta remains deeply committed to advancing patient safety through education, system-wide initiatives, and cross-sector collaboration. The Maltese Minister for Health and Active Aging is dedicated to a boundaryless approach to patient safety across both health and social care systems, ensuring integration across all levels of care, vertically and horizontally, from hospitals to home-based care. This includes prioritizing person-centered care, which gives patients a voice, considering them as active recipients of care, documenting their experiences, and actively involving them in co-creation of their health or healthcare management plan. Malta is committed to patient safety through education, system-wide initiatives, and evidence-based decision-making. The University of Malta's Department of Health Systems Management and Leadership runs a Master of Science course in patient safety and clinical risk management, which is amongst a handful available globally as a standalone course, to ensure that healthcare professionals learn within interdisciplinary settings to be equipped with the necessary knowledge, team building, and leadership skills to implement patient safety strategies effectively. At our main hospital, being a very small island of 550,000, the patient safety and quality improvement team plays a critical role in embedding a culture of safety. Through structured governance, incident and safety alert, learn reporting, as well as quality improvement frameworks, we foster continuous learning, resilience, and a proactive approach to patient safety and clinical risk management. Research and evidence-based medicine remain at the core of our approach, ensuring healthcare policies and clinical decisions are based on robust scientific data. The Mandal-Young Declaration on Patient Safety is a strong and well-structured document which we will look at and will be our guiding light for the years to come, emphasizing global collaboration, leadership, governance, and inclusivity in advancing patient safety. It projects a clear commitment to action, presenting specific pledges with a strong call to accountability and reinforcing the urgency of patient safety efforts. The declaration aligns with global frameworks, is people-centered, and recognizes the role of patients, families, communities, and healthcare workers. It also acknowledges emerging trends such as artificial intelligence, digital health, and climate resilience, as well as robust patient safety strategies in emergency preparedness plans. And this demonstrates a keen awareness of evolving healthcare challenges. Malta supports expanding patient safety beyond traditional healthcare settings. Indeed, we advocate for safety guidelines for informal caregivers, noting that the majority of care is indeed happening in informal rather than formal settings. Also, to provide structured psychological support for healthcare professionals who directly or indirectly and unintentionally would have been involved in adverse events. Malta stands ready to collaborate globally to ensure patient safety remains a fundamental pillar of healthcare systems worldwide. Thank you.
Next is the Republic of Poland.
Distinguished ministers, delegates, ladies and gentlemen, I come with a message of gratitude and hope. I would like to start by congratulating and thanking Secretary Herbosa and the Philippines Department of Health for your leadership and hospitality, as well as other patient safety weavers present here today for bearing the torch. This outstanding event gave us ample opportunity to reflect on the significance of our mission and the important choices ahead of us. The recent developments in patient safety in Poland can also be in part attributed to the advocacy and foresight of WHO, international experts and leaders. I agree with one of the speakers from yesterday who considered the COVID-19 pandemic. Something happened? Why not? Should I start over? This one? Nah. No starting over though? I was supposed to... Nope. I can speak very, very loudly. Oh, you can hear me. Perfect. I was supposed to be under 2 minutes, no worries. As I said, I agree with one of the speakers from yesterday who considered the WHO COVID-19 pandemic a somewhat positive event, a dress rehearsal. For us it was more, it was an important inflection point. In recent years, visibility of patient safety issues in Poland has improved significantly. 2 years ago, for the very first time, a governmental institution, the Commissioner for the Patient Rights, whom I represent, was explicitly mandated to lead action on patient safety. This came as a natural development for our organization, as our starting point was helping patients and handling their complaints, then providing compensation for harm and participating in court proceedings in cases of inter alia gross negligence. Having previously predominantly focusing on reacting to unintended consequences of the provision of healthcare services, it is now high time to take a more proactive approach, starting with building trust in the blame-ridden culture. In the post-pandemic world, the Ministry of Health of Poland sees safety and patient safety in particular as the priority challenge to tackle. To start with, we focus on the safety of women and increasing the scope of adverse event reporting. We welcome the notion mentioned yesterday, to each country has their own way to patient safety. We are weaving our own. Thank you for all your help and inspiration.
Dr. Herbosa, Dr. Vanson, Dr. Pukala, distinguished guests, ladies and gentlemen, it's an honour to be attending this summit as the head of delegation for Australia. And I'd like to thank the Filipino delegation for being such wonderful hosts and for everyone involved in this event. Please note the Australian government is currently in caretaker mode as an election has been called. During the caretaker mode, actions that may bind an incoming government are avoided. However, I'd like to extend my thanks to the keynote speakers who shared insights on patient safety and the implementation of patient safety measures. It has encouraged me to reflect on patient safety in Australia, not only the progress we have made, but the journey we have ahead of us. Thank you.
Now that we have already our technical problem solved, can we ask again, please, Republic of Poland, for your message? Thank you.
Yay! Yeah, that's an honor. Second time here. Should I say the same thing or try to... Again, it's a message of gratitude and hope because we wouldn't be able to do the patient safety without you. And this is from the bottom of my heart. I see great inspiration in what I'm seeing here with all of you today, showing us and yesterday the light, the road ahead for us, which we have to follow. And again, congratulations and thank you, Secretary Herbosa, and to the Philippines Department of Health for the hospitality leadership, and to other patient safety weavers, present here today for bearing the torch. The event, which is really outstanding, gave us some real opportunity to reflect on significance of our mission, the important choices ahead of us. The recent developments in patient safety in Poland can also be in part attributed to the advocacy and foresight of the World Health Organization, international experts and leaders. I agree with one of the speakers from yesterday who considered the COVID-19 pandemic a somewhat positive event, a dress rehearsal for us all. For us, it was more in Poland. It was an important inflection point, and it changed a lot how we act, how we behave, and how we see healthcare and our challenges. In recent years, the visibility of patient safety issues in Poland has improved significantly. In 2023, for the very first time, a governmental institution, the Commissioner for the Patient Rights, whom I represent, was explicitly mandated to lead action on patient safety, which means it was the first time we have the institution who is formally in charge and who's a leader in this topic, which is, as you know, absolutely crucial to have and forward momentum in crucial topics like this. And for us, this came as a natural development of our competencies as the institution. We started by helping patients, dealing with their issues, with their complaints, with the harm they sometimes they are part of or it happens to them. We started providing compensation to patients. And now it's a natural next step for us to not only react to unintended consequences of treatment, but also it's high time for a more proactive approach. And this is patient safety for us. We are starting by building trust in the blame-ridden culture, which is also an important issue in Poland. In the post-pandemic world, the Minister of Health sees safety and patient safety in particular as a priority challenge to tackle. To start with, we focused on the safety of women and increased the scope of adverse event reporting. We welcome the notion mentioned yesterday that each country has their own way to patient safety. We are weaving now our own, and thank you very much to you all for help and inspiration.
Next is Republic of Singapore.
Good afternoon, Your Excellency, the Honorable Dr. Teodoro Herbosa, the Secretary of State for the Republic of Philippines, Honorable Ministers, distinguished guests, ladies and gentlemen. Singapore continues to recognize patient safety as a top priority in the delivery of care at all levels. Singapore reaffirms our commitment to the Global Patient Safety Action Plan 2021 to 2030 and its vision of a world in which no one is harmed in healthcare and every patient receives safe and respectful care every time, everywhere. Singapore is also committed to the Mandaluyong Declaration on Patient Safety to foster stronger international cooperation and declaration towards our common goal of patient safety. As health ministries, we are uniquely positioned to act as catalysts in ensuring that patient safety remains at the forefront of our national health agendas, particularly in the face of evolving healthcare challenges. The path to sustained improvement requires our continued engagement and support, creating environments where healthcare systems can learn, adapt, and strengthen their practices. While each nation's healthcare journey is distinct, our shared commitment to patient safety unites us. In Singapore, we also recognize that patient safety is inextricably linked to ensuring the financial sustainability of healthcare delivery. Preventable adverse events not only harm patients, but also leads to unnecessary waste that incurs unnecessary costs for our healthcare systems. In Singapore, the Ministry is in constant collaboration with our healthcare providers and other partners, including patients themselves, to support healthcare providers with appropriate resources and enabling structures that allow them to promote a culture of safety across all domains of care. This includes capability building, best practice guidance, and collaborative platforms to bring stakeholders together to address national areas of concern amidst the complexities of healthcare. We applaud collaborative efforts such as this Ministerial Summit, which provides a platform for delegations to learn and share our experiences with one another. And Singapore stands in solidarity with the global community in implementing the Global Patient Safety Action Plan and the adoption of the Mandaluyong Declaration. We will remain an actively engaged partner in promoting patient safety worldwide. So, Maraming Salamat Po. Thank you very much.
Next is United Republic of Tanzania.
Dr. Teodoro Herbosa, Secretary of Health, Department of Health, Philippines. Dr. Saia Piukala, Regional Director, WHO Western Pacific. Dr. Eduardo Banzon, Director, Asian Development Bank. Honorable Ministers, distinguished ladies and gentlemen. It has been an honor to join you at this pivotal gathering, and on behalf of Honorable Minister of Health of Tanzania, I extend my gratitude to the government of the Philippines and the organizing committee for convening this important summit on patient safety this year. Tanzania remains steadfast in its commitment to building resilient, adaptive, high reliability health system that prioritizes patient safety in alignment with the Global Patient Safety Action Plan of 2021-2030. To achieve this, among other efforts, we have established Health Quality Assurance Unit at all levels of our health system and strengthened professional regulatory authorities to uphold the highest standard of care. Our patient safety policy guidelines serves as a roadmap to foster a strong culture of patient safety across all healthcare institutions. Aligned with this year's theme, weaving strength for the future of the patient safety throughout the healthcare continuum. Tanzania has made significant progress in reducing avoidable harm, with the key initiatives includes First, patient safety and infection prevention and control guidelines to curb healthcare-associated infections. Second, implementation of 5S Kaizen for total quality management improvement for improving efficiency and quality. Third, healthcare-associated infections surveillance system for early detection and response measures. Fourth, evidence-based standard treatment guidelines to ensure rational use and combat antimicrobial resistance. And fifth, safe surgery initiative, including the WHO safe surgery checklist and the National Surgical Obstetrics and Anesthesia Plan. Furthermore, Tanzania fully supports the Manduluyongo Declaration on Patient Safety, reinforcing global collaboration, advancing leadership, integration of patient safety into disaster and emergency preparedness, and climate resilience, and people-centered approach to patient safety. Together, we can achieve zero avoidable harm and safer future for all. Salamat sa inyo.
And last, Kingdom of Thailand.
Distinguished ministers, regional director, head of delegates, international experts, and esteemed guests. On behalf of the head of delegate from Thailand, we remain committed to advancing patient safety, recognizing its fundamental importance as a pillar of universal health coverage and sustainable healthcare systems. Thailand has made significant in implementing the Global Patient Safety Action Plan into national policy that place great emphasis on patient, personnel, and people safety, all 3P safety policy. We integrate a systems-based approach to minimize harm and enhance healthcare quality. We also ensure continuous improvement of healthcare outcomes and TP safety goals through hospital accreditation. We have successfully expanded the national reporting and learning system to report experience and incidents from people via mobile application for building a people-centered approach to patient safety. This system has fostered a culture of reporting and learning from others with an emphasis on system improvement rather than punitive measures. We empower the role of quality and safety leaders in healthcare professionals, and we are incorporating this into their continuing professional development. On the cell healthcare for safety, and move to be an active partner in the healthcare system development. Furthermore, the recent earthquake in our country has underscored that the importance of preparedness for disaster and emergencies that integrated into TP safety goals and hospital accreditation standards. Finally, Thailand commits to continuing the momentum of the Global Ministry Summit by actively participating to ensure quality and safer care for all patients, personnel, and people, always and everywhere. Salamat po for excellent, invaluable, and inspiration summit that organized by all of Philippines team ขอบคุณค่ะ
Thank you to all. Another round of applause, please, to everyone. Thank you for your support, insights, and commitment. Maraming salamat po. And now, as we draw this momentous summit to a close, we have the privilege of hearing the closing remarks from a leader who has been instrumental in making this event a success. Please join me in welcoming again the Secretary of Health of the Philippines, Dr. Teodoro J. Herbosa.
I hope the mic works. Yes. Excellencies, honorable ministers, distinguished delegates, esteemed resource speakers, partners, colleagues, and friends. As we bring the 7th Global Ministerial Summit on Patient Safety to a close, I extend my deepest gratitude to all of you for your presence, your insights, and your steadfast commitment to this cause. This summit has powerfully woven together a shared vision, a collective expertise, and a unified purpose. Here in Mandaluyong City, we added another strong and vibrant thread to the global tapestry of patient safety, building on the rich patterns set before us, from London to Bonn, Tokyo to Jeddah, Montreux to Santiago. And now, through the Mandaluyong Declaration, we collectively reaffirm our determination to ensure that patient safety is woven into every interaction, every decision, and every structure in our health system. To sustain our efforts, we must take the following actions. First, we must move from commitment to implementation. Policies and frameworks are essential, but they must be backed by real, measurable changes at every level of the healthcare system. Second, we must strengthen international collaboration and knowledge sharing. Patient safety is a shared responsibility, and the solutions to our challenges lie in our collective wisdom. Let us continue to foster partnerships, exchange best practices, and support one another in building stronger, safer healthcare systems. Third, we must invest in patient safety as a fundamental pillar of healthcare. Investing in patient safety is both an ethical duty and an economic necessity. Sustainable funding, infrastructure development, and workforce capacity building are critical. Without proper investment, patient safety efforts will remain fragmented and unsustainable. We must prioritize patient safety in our national budgets and create a collective funding mechanism and infrastructure similar to that of the Pandemic Fund for Pandemics or Loss and Damage Fund for climate change. One that countries, especially low and middle income countries, can access to support their patient safety initiatives and incentivize the implementation of best practices at every level of care. Fourth, we must incorporate the framework of patient safety in the design of our facility infrastructures and workplace settings with the highest standards of safety and care, especially in disaster-prone and climate-affected areas. Every aspect of our facility, from the layout of the patient care areas to the design of staff workspaces, this must be optimized to minimize risks and enhance the overall patient experience. We have gained the following key takeaways from the 3 tracks. From the hospital track, we recognize the urgent need to build resilient healthcare infrastructures capable of withstanding climate and disaster-related disruptions, ensuring uninterrupted patient safety during crisis. Equally vital is fostering psychologically safe and healthy workplaces alongside harnessing artificial intelligence to enhance patient safety. In the primary care track, we reaffirmed that patient safety extends beyond hospital walls, encompassing primary, ambulatory, community care settings. Moreover, we underscored that diagnostic safety is not just a health priority, but also an economic imperative. Finally, the governance track highlighted the importance of empowering patients as active participants in their care. Strong leadership plays a crucial role in making patient safety a top priority, fostering synergistic partnerships across all levels of healthcare and ensuring meaningful investments that drive people-centered care. To member states, thank you for your valuable contributions to the patient safety. To our esteemed resource persons and experts, and to our Patient Safety Steering Committee, we are grateful for your willingness to share your knowledge as you weave together the lessons, the innovations and evidence that will shape our future actions. Your insights are guiding threads in our ever-growing tapestry of global health. To the summit's organizing committee, led by Undersecretary Kenneth Ronquillo, composed of our various offices from the Philippines Department of Health, including the Universal Healthcare Policy and Strategy Cluster, the Health Regulations and Facility Development Cluster, the Health Facility Development Bureau, the Bureau of International Health Cooperation, Health Promotion Bureau, and the Finance Management Bureau, and the Administrative Service, we extend our heartfelt thanks for your meticulous coordination, creativity, and unwavering commitment to organizing this wonderful summit. Maraming salamat. Pang-international na po tayo. To the Asian Development Bank, and especially Dr. Eduardo Banson. Is he here? Yeah, hey! Our sincerest appreciation for accepting our invitation to collaborate and co-host this significant event. The setting has been perfect, and the food was nothing short of exceptional. We cherish our partnership with the ADB, and we ask everyone to join us in giving them a well-deserved round of applause. Dodo, may I be able to announce that you are also willing to host the fund if there ever will be people that will contribute to that fund. The Asian Development Bank says they have experience in handling such funds. So if we do decide to create the Global Patient Safety Fund or whatever we call it, we have the Asian Development Bank already volunteering to help. To the other national government agencies and private partners, especially the Department of Foreign Affairs, the Department of Tourism, who hosted the tour on the pre-conference day, to the to the National Commission on Culture and the Arts, the Department of Interior and Local Government, the Philippine National Police, the ministers, each one had a security detail, the Bureau of Immigration, thank you very much for assisting one of our speakers to be able to get through and board the Turkish Airlines from Istanbul, to the Bureau of Customs, to the Manila International Airport Authority, and the new NAIA Infra Corporation. Thank you for the generosity of extending your resources and support, ensuring the success of this summit. To the cities of Mandaluyong, Pasig, and Quezon City, these are the nearby cities, thank you for your unwavering commitment to the safety and the essential support you provided in creating a secure environment for all delegates and participants. To the World Health Organization, our local and international partners, the interpreters, the communication teams, and to everyone who have worked tirelessly behind the scenes, maraming salamat. To those who attended this event, we had 476 physically present in this hall, 54,872 registered watching on our live streaming in the Department of Health social media platforms, 1,500 logging in our Summit Zoom platform. Your presence made this summit an overwhelming success, and may I take pride that it's probably the largest global summit on patient safety with that type of attendance online. And finally, To the patients, the families and communities who continue to give meaning to our mission, we draw strength from your stories, your hopes. Indeed, there is no patient safety without our patients. You are why we do what we do. Let's give them a big hand of patient safety. The tapestry we all have weaved in this summit affirms what we know to be true, that any nation with courage, collaboration can serve as a platform for global dialogue and solidarity. I warmly encourage other countries to take up the mantle of hosting future summits. It is not only possible, but it also is a powerful opportunity to lead, to share, and to shape the future of global health together. You know, one of the tasks of the host country, aside from creating the event, making the schedules, making sure every minister is taken care of, is to choose the next destination. I regret to inform you that I have not chosen a new destination, but I have 3 countries that have stepped forward to volunteer, and they will be going back to their governments to actually ask permission if they can do host in 2026. And I have the privilege to name the 3 destinations, or if there are still others who want to approach me. My idea is that maybe these 3 countries can go to their ministries of health and find approval, and I will announce it during the World Health Assembly, where I will be sitting as president of the WHA. Can I name the 3 countries? No. Okay. My executive assistant said no, but I'm sure there are more. What I said is that I think I will not give the global patient safety one commitment, but I will probably get all of them and line them up in the succeeding years after Singapore hosts the 2027. So we have one open for 2028, 29, 2030, etc. So, in behalf of the Republic of the Philippines, the Department of Health, and our partners, thank you once again. May our paths cross again as we continue the vital work together. Mabuhay, and thank you very much.
Thank you once again to the Secretary of Health of the Philippines, Dr. Teodoro J. Herbosa. And again, congratulations to you and to the whole team. And now, ladies and gentlemen, let's do a recap of the highlights of this incredible 2-day summit. With this video presentation, let's all watch this.
Deserves care that is safe, effective, and free from preventable harm. The true measure of our leadership is not in the policies we write, but in the lives we protect.
Now we have different arenas and different environment in every country with regards how patient safety is all about.
Consumes healthcare resources, 6% of total hospital bed days and more than 7 million hospital admissions. powerful testimonies. And these conversations have reminded all of us that patient safety is not a code, it is a right to every patient rooted in dignity, equity, and trust that must exist between people and the systems that serve.
Is a difficult one, but the Philippines, with the leadership here, is in a very, very strong position, not just to do things for the population of your country, but also to work with other health leaders around the world.
It is with pride that I share with you what we have successfully hosted, a 7th Global Ministerial Summit on Patient Safety.
Patient safety would be difficult to do. Yes, you could say it can be done, but we believe that Asia should invest more in health infrastructure that is both resilient, that is low carbon. In a sense, it's time to upgrade, and UNADB has been supporting a lot of our member countries in upgrading health infrastructure.
Countries to step forward and continue hosting these crucial summits. Your leadership is essential in sustaining this movement and ensuring that patient safety remains a global imperative. Let us leave this summit with renewed commitment, shared purpose, and the determination to build a world where patient safety is a reality for all. Thank you very much, and thank you to all.
Healthcare is not an option, it is a right. So thank you very much for joining us today.
What a fruitful summit it has been. Now, before we say our goodbyes, just some few announcements. After the program, there will be a group photo opportunity. So all of the attendees are invited to join outside this main hall for a group photo of all the attendees. And right after that one group photo outside, we will invite back again here on stage the members of the steering committee and DOH organizing committee to have a separate photo opportunity on stage after the group photo outside our venue. And also, just an announcement as well, before exiting the auditorium, we kindly ask all delegates to return their interpretation headset and earpiece at the designated drop-off point. To all of you, thank you again for your participation and dedication and commitment. Once again, I'm Diane Keller. Until we meet again at the 8th Global Ministerial Summit, safe travels to all and have a good afternoon. Thank you very much.